be explained. Now यहाँ तक तो हमने बता दिया, जैसे कोलेस्ट्रम ये है वो है. Now how will you know that now the colostrum is getting changed to breast milk? सेकेंड या थर्ड डे, अगर कोई टर्म बेबी है तो फ्रॉम सेकेंड डे itself it starts. Otherwise, third, fourth day, the mother will feel engorgement. The breast will be full. It will be warm. Sometimes mother also gets rise in temperature while feeding the baby. The baby will not be sucking, or there might be milk leaking. That's when the cholesterol to the milk. This transition starts. At this point, there is more production of milk, but then the baby is still lazy, not feeding. That causes engorgement. So you have to train the mother to improve latching, to make the baby suck. Tell her that when the baby should be fed, it's not the time feeding, also the demand feeding. And if both things are not being established, how to flick the fit, how to initiate the feeding, how to make the baby feed. ये नहीं कि बच्चा सो गया है, वो नहीं पी रहा है, तो कैसे उसे जगाना है? क्या कर सकते हैं आप? कौन से मेजर्स आप कर सकते हैं जिससे बेबी जागेगा और फिर वो वापस ब्रेस्ट फीड लेगा? ये नहीं कि बेबी को आपने इतनी जोर से फ्लिक किया कि वो रोने लग गया. अगेन, हाउ टू सूद द बेबी एंड start with the breastfeed. This one saint, the mother, the moment a child is born, the mother is also born. She never existed before. The women existed, but mother never. A mother is something absolutely new. That new mother needs this support from a lactation counselor, support from a guide, support from a midwife, support from all of us who are sitting here, whether directly or indirectly. Again, when to start colostrum harvesting? If anybody influenced by this, like, I was self motivated. I never wanted my baby to go to an ICU. I never wanted my baby to get pricked right on the first day of his or her birth. So I was self motivated. Whatever I could do, I will do, just to protect my baby. वो हर माँ चाहती है. मैंने कुछ नया नहीं किया. Just support her. If anybody is confused, like, पहले ही बता दिया, पेट में पानी कम है, माँ वहीं डर जाएगी. पेट में पानी ज़्यादा है, माँ वहीं डर जाएगी. आपको डायबिटीज़ है, आपको हाइपरटेंशन है, ये सब हमने क्या किया? ये तो बता दिया कि क्या गलत है, लेकिन उसको सही कैसे करना है वो भी तो सिखाना है. सो when to start? Again, I am focusing on the same point. Secretion will start as early as 16 weeks, but then expression should be done after 37 weeks. Q, there are always chances of premature labor if not done this colostrum harvesting correctly. Just to avoid that condition, we are advising mothers to do this after 37 weeks of pregnancy. And then for further information, they can talk to their midwives or obstetrician, because ultimately that colostrum has to be taken to the hospital when the woman is going for her delivery, whether it's a normal or a cesarean, elective or emergency. In both the conditions they have to carry. So if anybody is planning, or if you are advising anybody, so that lady, that mother should inform wherever she is going to get her delivery done. At that place she must be having the provision of refrigerator and everything, that I am coming with my colostrum, that is what I want to feed my baby, so please keep so and so things ready. Now what all things will be needed, that will discuss further. Now, question comes, who should do this? Is it necessary for everyone, or there are specific conditions who really need this? So this is the answer. Women with diabetes in pregnancy, whether the pre-existing diabetes or gestational diabetes, infants diagnosed with like during antenatal period with cleft lip or palate or congenital conditions, mothers having an elective cesarean sections, infants with intrauterine growth retardation, Mother with breast hyperplasia or who had previous breast surgeries, uh, then you would have heard कई लोगों को कंप्लेन होती है गठाने हो जाती हैं, right? Those are the fibrous tissues formed in the breast. That is just a benign condition. Again, in fact, किसी भी lady को अगर ये हुआ है, she can go for this colostrum harvesting, cause आगे चल के lactation establish करने में इनको problem हो सकती है. Women with multiple sclerosis, strong history of dairy intolerance or inflammatory bowel disease, mother with high blood pressure, mother with beta blockers. So, those mothers who are on these drugs. Now, again, how to do it? Very simple, nothing technical. Only things what we have to take care is keeping the asepsis. This is the common practice of expression of breast milk from the uh, upper part of the breast moving towards the alveoli. You have to compress the alveoli, you have to make a C cup hole, and then you have to push towards the nipples to take out the secretions. Now these secretions can be either collected in this kind of vials which you can see. These are specially made to harvest the colostrum antenatally. So either they can take help of someone who will collect it and then she can express it out, or once the secretion starts coming, she can collect it in some sterile or clean bowl and then take it out with a syringe. So this thing has to be done twice or thrice in a day. For one day we have to use one syringe. If the secretion is more than 2 ml, then they can go for two syringes. Otherwise, one syringe is enough. Once taken, like today, she has collected two times in that one syringe a date, because this colostrum can be kept for 6 months in the deep freezer, not the normal fridge. In normal fridge for 4 to 5 days. But once you have taken out of fridge, it has to be finished within 12 hours. Whether taken today, yesterday, or 6 months back, you have taken out, वो मेल्ट हो गया, आपको अब बेबी को देना है, नॉर्मल टेम्परेचर पे आ गया है, उसको आपको 12 घंटे के अंदर खत्म करना है. अब सवाल ये आ रहा है कि मान लीजिए कि हमने कोलेस्ट्रॉम निकाल के रखा था, ठीक है, आपने कोलेस्ट्रॉम हार्वेस्टिंग करवाई है, पेशेंट को आपने पूरा गाइड किया है, उसने पिछले 2 महीने से उसने कोलेस्ट्रॉम निकाल के फ्रीजर में रखा है, लेकिन जब वो वार्ड में आई है, उसका डिलीवरी हुआ है, उसका नॉर्मल डिलीवरी हुआ है और उसको उसका बेबी ने सक करना स्टार्ट कर दिया, अब वो जो रखा हुआ है कोलेस्ट्रॉम उसका क्या करना है? That should not be discarded. This colostrum, if you want to feed the baby, feed it. Don't discard it. This thing is so effective if a baby gets any kind of rash, any kind, whether it's a diaper rash or any infection, anything, that thing can be applied on that and thing will disappear. Conjunctivitis common है बच्चों में. That is the best treatment for that conjunctivitis. So it's not just the baby is feeding. You can even treat your baby with that. अभी आई फ्लू हो रहा है, बेस्ट थिंग फॉर द ट्रीटमेंट ऑफ आई फ्लू. एंड दिस इज नॉट अ न्यू प्रैक्टिस. गांव में अगर किसी को आंख आती है, ठीक है, कंजक्टिवाइटिस, सो उसमें ब्रेस्ट मिल्क डालने के लिए कहते हैं. यस, इट्स इन प्रैक्टिस. इतना एंटीबॉडी से उसमें है. किसी को अगर क्रॉनिक कंजक्टिवाइटिस है, हफ्ता हो गया, 1 महीना हो गया, नहीं ठीक हो रहा है, सारे आई ड्रॉप्स डाल दिया, गो विद दिस. This is all tested. You can go through internet, you can go through different database, you'll find the studies related to this. It's all scientific. So it's not that once the colostrum is collected, it's not used, you have to discard it. No. For 6 months, you can use it in different ways. Its only thing is we are collecting it, which the body is producing, and we are storing it. If the baby needs, you will feed the baby. If the lactation is established, if the mother is able to feed the baby properly, very good. especially for those having LSCS, whether elective or emergency. How many mothers are here who have had LSCS? And how many of you have fed your baby within first hour? And how many established that feeding for next 3 days? So, yet the number is less. And how many had normal deliveries? And how many of you started your feeding within an hour? Again, the number is less. This is where we need to work. So, this is all what I have told you. If you want, you can read it. Otherwise, you can ask me anytime. Uh, Again, which I told you, breast expression is the best technique to harvest the colostrum. Why? Because if you are using any kind of pump, first thing, secretion will not come because it is very sticky, and if it comes also, it will stick to the pump. वो आपको स्टोर करने के लिए मिलेगा ही नहीं, वो इतना थिक रहता है, वो पंप में ही चिपक जाएगा, तो फिर आप क्या स्टोर कर पाओगे? So each drop of colostrum is precious. That's why it is known as the golden drop or the golden secretion. So what the previous pictures where I showed, each drop can be sucked by a syringe, or it can be collected in a bowl, in a clean bowl, and then further it can be taken in a syringe. Take it in one syringe for one day. Use one syringe. Start with 2 ml syringe. Whether you get a drop or a two, store in that syringe. Put it in the freezer. Take the second expression in the afternoon or in the evening for one day, one syringe. Once that syringe is full, even if it's 1 ml also, cover the syringe with a put it in a ziploc, put it in the freezer. If the delivery is planned within 2 to 3 days, no need to put it in the freezer. You can put it in fridge, not on the door. फ्रिज के अंदर वाले साइड में जहाँ से एयर आता है, एंड देन यू कैन टेक टू द हॉस्पिटल. क्योंकि डे आपको पता है कि 2 या 3 दिन के अंदर आपकी डिलीवरी होने वाली है. इफ इट्स नॉर्मल डिलीवरी, तब आपको शायद वेट करना पड़े कुछ घंटों के लिए. देन यू कैन पुट इट इन फ्रिज अगेन, पुट ऑन डोर. बट इफ इट्स LSCS, देन यू नो कि आपके 2 घंटे के अंदर आपका प्रोसीजर खत्म होकर के बेबी आ जाएगा. So don't put it in fridge. It will be in normal temperature. Once the baby is out, baby is clean, start feeding it. That's it. Nothing magical. Only needs your practice and determination. So how many of you are willing to make your patients practice this? कितने लोग करवाने वाले हैं अपने patients को ये practice? So I cannot share this picture because I have not taken the consent. There was one colleague of mine. She was like in my department. So I advised her for this colostrum harvesting, and she did it for 2 days, and then she went for normal labor. But then she had a prom, so and at night I was not there with her. Morning when I reached, so usko baby ko top fit de diya. Though colostrum was there, they gave the top feed. फिर उसके बाद कोलेस्ट्रम दिया हमने. But that started jaundice in the baby. But again, with a good lactation, we were able to clear it all within 2 days. Because ultimately, the physiological jaundice, it needs hydration, it needs warmth. All those was provided, and within 2 days, without any medication, the jaundice was cured. Now the baby is good, lactation established, and you are happy. This is something which I always love. नास्ति मात्र समा छाया, नास्ति मात्र समा गति, नास्ति मात्र समम त्राणम, नास्ति मात्र समा प्रथा. माता के समान कोई छाया नहीं, कोई आश्रय नहीं, कोई सुरक्षा नहीं. माता के समान इस विश्व में कोई जीवन दाता नहीं. इस ताकत को समझो, इसके लिए कुछ करो. Thank you. Thank you very much. I hope I have not taken much time, but then I would be very happy to answer your questions if you have any. And I want you to ask me questions. Or shall I ask you questions? Is there anybody who want to ask anything related to this? So shall we conclude? Yeah, beautiful ladies. I think I'm very clear with the topic. There's nothing much to discuss. Yes, ma'am. Yes, ma'am.
Thank you. Thank you for your talk. It was wonderful.
Thank you, ma'am.
My question is, if colostrum is very good for infections like eye infections, ear infections, is breast milk is also good or just colostrum?
No, ma'am. Breast milk is also equally good, but then yes, colostrum has more amount of lactoferrins and stuff, and it reduces in the breast milk. But depending upon the baby's need, because preterm babies will have a different breast milk. Mother to mother, it will vary. Level of the nutrients in the breast milk will vary because if a mother is anemic, if a mother is malnourished, that she cannot supply a good breast milk to the baby. So again, that varies.
I was just thinking, like, most people don't save their own colostrum. So when the baby is like 2, 3 months old, then there is no colostrum.
Yeah.
So if they can use breast milk, that's also good.
Yeah, that's also good, ma'am. Yeah.
Okay, thank you.
Thank you. very much.
Thank you for
You are
clarification.
looking very beautiful, ma'am. Anybody else? So thank you very much once again for listening to me patiently. Thank you, आप दोनों को भी.
Thank you, ma'am. Thank you so much for your valuable information. This is much needed in the context of India, where superstition and myth exist a lot. People of here still believes colostrum is harmful for newborn babies. They will feed honey as a first thing when the baby born, but not colostrum. And they still think that गाय का दूध पिला दो बच्चा गोल मटोल होगा but not mother's milk. So this session is really helpful, ma'am, and thank you so much, ma'am. Now we are moving towards our panel discussion, and we are taking 5 minutes break for arranging our setup for panel discussion.
ये बंद है ना
Hello, hello. Hello, 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 hello. Hello, 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 Hello. 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 Hello.
our presentation time, we will go there and have people explain. So no need of PPT to project. PPT presentation you can go present and explain it from there. And if in between I want to ask anything, I will ask you. Like any point I want to get it clear, right? Then I'll ask you. I got the topics of affirmation and guided visualization. अभी काय करू Even though it's open, I will accept.
Hello. Hello.
Yeah, I was trying to say that even the breast milk also, if we are keeping it in not yeah, in temperature, when it's too hot, then we advise them to keep it in fridge. And whenever they are going to like give the baby, then they can throw it in. Because websites are also yeah, session is live also because there are questions on YouTube as well. So yeah, so it will be entire discussion and answer. One was like on the other side, and one was on the side outside and even ma'am we are also this activities from training from the Ministry of Education and the paramedic staff from also anyone as well as from the Ministry of Health. The police paramedic there again the volunteer is not friendly because as it is not there if we are schooling also again it is if we are not maintaining a record they are very they are we use nowadays now because we are already revised on this custom and then we will be cooperated by the local authorities
Okay, welcome back. So we are now moving towards the our next session, panel discussion. In giving birth to our babies, we may find that we give birth to new possibilities within ourselves. To make us aware regarding diverse modalities of painless delivery, we have our knowledgeable panelists with us. So now I would like to call all the panel member, those who are already here, Miss Renuka GB ma'am, National Midwifery Educator, National Midwifery Training Institute, Meerut. Then Mrs. Nima Bhaskar ma'am, Vice Principal, College of Nursing, Ayodhya. Then we have Miss Renata ma'am, International Midwifery Educator, Lithuania, UK. Now, last we have our ma'am, Miss Ruxana Khatun ma'am, mentor, Siddharth Nagar. And I would like to request our Neeta Bhide ma'am, professor come HOD from SGT University, Gurugram, as moderator for our panel discussion. Okay, ma'am.
So let's start with this discussion. Another important topic, another very interesting topic. There's painless modalities of normal delivery. Yes, it's painful to be a mother. And yet, it's the pleasure of giving birth to the child which we are carrying for 9 months. Today, we'll be focusing on discussing the various modalities which is in giving birth. To start with the session, I would like to invite Ms. Renuka, where she'll be helping us to know the different modalities, that is hot and cold fermentation, hydrobirthing, and stuff, which aces in giving birth, which reduces the pains, which makes it easy to give birth naturally. Renuka.
Thank you so much. Uh, from yesterday's and today's session, we have discussed a lot about the pain which a mother goes through. So birth never happens without pain. But yeah, in the first stage of labor, we can reduce the pain perceptions by different methods. You can say non-pharmacological methods of pain relief, which as a midwife we used to provide to the mother so that her journey in the first stage of labor could be, good, and she can feel confident, and she can tolerate the intensity of the pain, and this pain can be minimized at an extent. So we all know pain is it's not a very pleasing experience for anyone. So you might have heard about the gate control theory of pain. How many of you have heard? So gate control of theory of pain is when we feel pain, how we perceive it. So there are two fibers. One is A beta fibers and C fibers. A beta fibers, takes the pain perception in slow mode, but C fibers, it is the diameter is quite larger, so it send the perception quickly. So what we do, we block the pain perception of our mothers in order to help her in reduction in the perception of the pain. So how we do it? As we know, we have 5 different senses. One is touch, sight, taste, smell, and through hearing. So for each senses, we help our mothers to give them such a experience so that they may feel less perception of the pain. Like for the touch, we use massages and showers, etc. For the sight, motivational videos. For taste, food and hydration. Smell, aromatherapies and all. Here, like birth affirmations and all. So my today's session, which I am going to deal, is about the warm compress. So how this warm compress help mother to relieve her pain. So what happens when the mother is in first stage of labor? The pain from the beginning of the true labor pain, she used to start contracting, and this contraction increase her the pain perception. So what we will do actually, we provide warm compress to the mother, and this warm compression help her in blocking the pain perception of the mother. There are various methods by which we can do. We can provide her packs, frozen cans through pocket of peas and ice cubes, or we can use cold wet clothes or heat packs. There are different methods. Even we can take a socks and put some rice in it, microwave it 1 to 1.5 minutes, and that the socks we can use in her, because she feels pain at the back of her spine cord, and she has that pain there because the pain starts from the back and radiates toward the front. So with the help of the compression, we can reduce this pain to some extent. Then the second thing is what we can do, but we have to be cautious. We should not really, because when mother feel so much intensity of the pain, she will ask you to leave that socks there or the hot compress over there. So it can cause burns. So we have to be very mindful while dealing with such things. We need to change the position in time to time and help her to understand that we cannot leave it for the long time. So changing position will help her. Then the second thing is we have seen it in a research done that about 12% of the women's pain has been relieved by using such kind of warm compress techniques. The second technique which we can use is hydrotherapy or shower. So this hydrotherapy is hydro, you understand, it's the water. So she can be inside the pool, warm water pool, or she can take the warm shower. And that is the reason it is important to have a washroom facility just near to her mother's labor room. Why? Because if she wants to feel the soothing effect of warm shower, she need to go to washroom, and she will put a chair there and she will sit means backside front, like in opposite direction inside in the chair. Like I'm sitting in front, but she has to sit at the back. And what she has to do, the the water of the shower should be lukewarm, and it should fall directly on her back or on the belly. It will help her in reducing the pain. And it has been seen that it is very, very effective. Or and she can sit for 10-20 minutes, and she will feel like the perception of her pain will be reduced. Even she can use the warm water pool also, not for the hydro birth, it's for the relief of pain. So she can sit inside the warm water pool, and she can lean over there, she can rest over there, and this will soothe her, it make her to feel relaxed, and she will be wanting to sit there more, because it helps in soothing her pain. So this is also one of the methods which we can use for helping her in reducing her pain perception. And we need to understand that the temperature of water should not be more than 36 to 37.5 degrees Celsius. So, how it helps? You might have heard about the endorphins. Endorphins are, you can say, they are natural painkillers, or you can say they are natural narcotics, which are being produced when we get the warm shower. So they are being produced from different way, like if we do exercises or take massages, and these endorphins are being produced. And these endorphins, like if you do exercise, you feel good, so why it's so? Because the production of endorphin, that's why we ask mother to walk in the room, so that more endorphin can be produced and it will relieve her pain. So in warm shower also, the endorphins are being produced, and it helps her in reducing the pain perception. So this is one of the methods. And 18%, 18% of the mother sit in hot pool felt the reduction in the pain perceptions. The next technique is breathing techniques. So this is also one of the very, very effective method of relieving the pain. So we breathe. You might have seen people doing different kind of yogas in which we exercise breathing techniques. So in this, what you have to do, there's two kind of breathing. One is slow breathing, okay, or you can say distress breathing. So in this kind of breathing, you need to ask the mother to take deep breath through nose. I'll demonstrate it for you. And exhale through mouth. long, deep breathe inside and exhale. And when the mother will exhale through mouth, she will exhale all her stress, worries, and she will feel more relaxed. She need to sit in a relaxed position and need to do this technique, and it is really, really very, very helpful. So, what should be the average? Like she has to take 7 to 12 breath in a minute. So when she will say, usually we say when we count the respiration, it is about the 12 to sorry 16 to 20 breath per minute we used to count. But in this technique, usually we are chest breathers, but we don't want that. We need belly breathers. So when she will breathe from the belly, it will help her in reducing her stress, distress, and pain. So you can ask to the mother, sit in comfortable position, put her both hands on the belly, and she needs to take deep breath, hold, and just relax, and she need to blow out all her pains. And this technique, I'll say, is a very effective technique. The second is high breath or transitional breathing technique, and this technique should be used at the time when the mother is in second stage of labor. Okay, so in this technique, how a mother need to breathe? Two. This is the technique she need to breathe. Okay, so this is not the hyperventilation like it. This is not hyperventilation. She has to take two breath, and it will help the mother in reducing the highest intensity of the pain at the second stage of labor. And when the cervix is completely fully dilated, it will help her in relaxing. So it is said to be these both techniques are very useful. First, I told you like long breathing, you could be used at the first stage of labor, and this in the second stage of labor, so that she may not push and take the baby out, because it again may cause the tear. So she has to push, controlled breathing. You can say it's a controlled breathing, and she has to push. Okay, and it has been seen that the 48% of the mothers who did this breathing techniques have relieved pain. So this is a vast, you can say, if we totally we say, this breathing technique is very, very, very helpful in relieving the pain during the childbirth. So these three techniques which I have told are very, very helpful, and if we practice it, we can some extent we can relieve the pain of the mother. Thank you so much.
दर्द होना और महसूस करना, इसका अंतर बहुत अच्छी तरह से समझाया रेणुका ने. टेक्निक्स लाइक हॉट कंप्रेस, चेंजिंग ऑफ पोजीशन, हाइड्रोथेरेपी, वाओ, बहुत कुछ है जो किया जा सकता है. अब बात ही होती है कि हम कितना करने वाले हैं. So before going to the next session, I would just like to share one experience of mine. So during my masters, my topic of study was early breastfeeding in third stage of labor. This was to see the effectiveness of early breastfeeding on the duration of third stage of labor as well as the blood loss in third stage of labor. So, and I was not supposed to give any episiotomy, because if I'm giving any episiotomy, so that blood will like not give me a proper data कि third stage of labor में actually placental detachment से कितना blood loss हो रहा है. So just to avoid that, वहाँ ना तो मेरे पास कोई टब होता था जिसमें मैं उसको हाइड्रोथेरेपी दे पाती थी, ना ही मेरे पास कुछ ऐसा होता था कि मैं कुछ अलग कोई मोडालिटी कर पाऊँ. तो what I used to do, I used to take lukewarm water and put it on the perineum of the mother. So जब वो lukewarm होता था, इतना warm कि उससे जले नहीं उसे. So उससे एक तो उसको पेन कम होता था, और क्योंकि वो पानी फ्लो हो रहा है तो उससे चाइल्ड बेयरिंग में जब पैसेज हो रहा है तो वहाँ पे ल्यूब्रिकेशन होता था, and somehow I never needed to give any episiotomy. So this was not a very technical thing to do, but yet this hydrotherapy aged that delivery as well as it prevented episiotomy just by that small stream of fluid. I knew that this thing is existing, this thing we can implement, but then again, I was not having the facilities, the things to provide a particular uh, procedure in a standard way. But then, yes, some modifications we can always do to enhance our care, to make our work effective, to prevent complications, also to ease that process of childbearing, of childbirthing to the mother. Again, from where the topic started, pain. जब खेलते खेलते कोई बच्चा गिर जाए, चाहे उसे खून भी निकल आए, वो उसे पोंछ के वापस खड़े हो जाएगा खेलने के लिए, क्योंकि वहां पे पेन परसेप्शन कम है, उसको दर्द का एहसास कम हो रहा है, क्योंकि वहां पर वो खुश है, वो खेलते हुए खुश है. और वही एक चपत क्या पड़ जाए, सर आसमान पे होता है, उतना बवंडर मच जाता है. यहाँ भी बात वही है, अगर हम वो एनवायरनमेंट देंगे तो उस दर्द का एहसास कम होगा. अगर वो एनवायरनमेंट नहीं होगा, वही उतना स्ट्रेस होगा, वो साथ नहीं होगा, वो विश्वास नहीं होगा कि हाँ मेरे साथ कोई खड़ा है, मुझे कुछ होगा तो मुझे देखने के लिए कोई खड़ा है, मेरे लिए कोई कुछ कर रहा है. अगर वो एहसास नहीं होगा, वो विश्वास नहीं होगा, तो वो दर्द भी ज्यादा होगा. So, moving on to our next topic, where we are going to learn, we are going to know about self hypnosis, guided imagery, visualization techniques. We have Madam to explain about it. Over to you, ma'am. Yeah, you can use that. So Nima Bhaskar ma'am will be explaining us about the birth affirmation, visualization, and visual focus.
Thank you, ma'am. Good afternoon to one and all. Respected Director Sir, Principal Madam, and all the speakers, eminent dignitaries. Thank you for the opportunity given by Baba College of Nursing. They are doing a very wonderful job. I'm very happy and glad to present as a speaker in this panel discussion because this is a transition phase in India for all the midwife that we have to have a hand in hand to work for a normal natural birthing process. So before going to the topic, I want to thank all the principal teachers of different colleges and all my dear students to patiently listen our discussion. Okay. One incident I want to share, as I am like you as a student when I was in BSc nursing. All the department was very easy, community health nursing, pediatric, foundation of nursing. We don't have much conscious to go. When we become as a senior, as like fourth year of BSc nursing, one we hear about obstetrics ward, or will have like shaking, or we have an anxious. Some will feel like I will get fatigue or giddiness, the smell, or no, they have some anxious to go in the labor ward because of the screaming or crying or whatever the discomfort the mother feel. Maybe they self analyze themselves, or they will see the mother in this way. So as I was a BSc nursing student, I also feel like to little bit anxious to go in the labor ward. When I enter in the labor ward, first for few weeks, I had an incident. One primary mother, she was a very little girl, we can tell 16 to 17 years. Maybe she married early and she wanted to give delivered. She was in the face of labor pain. When she was going to deliver, she was screaming like that. Oh, why you made me married? What my husband did? Why I got my baby? Why all are around me? They are telling to control my pain. I don't want to control this. I don't want this pain. So like that, she was screaming like that. By seeing that girl, no, I'm also girl. I was more than that age. I was standing here looking, why she is doing all this? That much pain is there for the labor. Then what I decided, I was just observing. My senior teachers are there, seniors are there, and the midwife and the nurses and the doctors are there. She was struggling like that. She thrown everything like pillows, bed sheet, and she ran from that was in the second floor. She was running from there and she was going to the staircase to jump from the what terrace. That much that women having the pain of labor, because first primary mothers maybe they don't know about what is labor, which way the child is going to take birth, maybe through the vagina, they don't know. They are telling open, we are going to do vaginal examination, do push it. So they that in that phase the woman is experience lot of mental stress and pressure, and she don't know how to cope up that. So that was in 2000 I was experiencing. Now in the 2023 we are hearing so many painless modalities like water birth or hydrotherapy, or like we have like aromatherapies, or we can keep our husband nearby, or relatives, our mother or sister, so much of pleasant environment. I have seen so many deliveries of auto delivery. On the labor room the women will deliver, nobody is there to smile at her, nobody is there to touch her, nobody is there to give a calm kind word. Yesterday madam was telling kindness and empathy is very much essential in our field, that will give for more confidence for her to give a birth for the baby. So we have to together couplet care we have to give for the mother and the baby. The same primary mother, I visited the next day. Next day, she was very happy. Next day, she was very happy. She was holding her baby. She was feeding her baby. And she was very happily talking with her husband. Then I was thinking, yesterday she was doing all the drama. Today, she was very much happy with her husband and the child, because she experienced my child, whether she is a less age also. She was holding her baby, and she was proud to become a mother, and she was proud to give breast milk. So that if she is knowing this all concept during her pregnancy itself, I can able to conduct labor. I can able to hold my contraction. I can visualize my baby is going to deliver in a healthy way. I can be with my partner. So I am in a relaxed and calm environment. Then her pain level will be decreased. She will not do the activities of jumping from terrace or like that. Am I audible? Okay. So this I want to relate with my topic. So everybody, we need some positive statement in our mind that we can do it. We can cope up with the environment like that. So my topic is like birth affirmation. Can anyone tell what is affirmation? Affirmation, students. Affirmation. Anyone? Affirmations are positive statements. I can do this. My baby will be healthy. I can control my pain. My contractions will be cope up by myself. As a new beginners, no new nurses, you also fear how I will complete my course, how I will write my examination. So if you have the uh, positive statement in your mind, you can able to cope up with every situation. Am I audible? Okay. So the topic is birth affirmation. Birth affirmations are specific statements that promote positive thoughts and emotions. In this scenario, we need self empowerment. Nobody will give you hand unless and other than you have your self belief. Same like the mother has to have her self belief that I can deliver a good baby, healthy baby, normally as a normal physiological birth. I can control my pain. I can see a cute baby in my hand, like that she should have the positive statement. Not only mother, everybody, everyone sitting here, no, I can do, like that you should believe yourself. Nobody will give you hand, only they will support you in your failures or anything. Same like during her labor, she should have a positive statements and emotions in her mind that will bring her a healthy natural physiological output. My job is to simply relax and allow the birth to happen. Some statement. Hypnobirthing affirmation. So this can be done in the childbirth classes. This can be started in the pregnancy period itself. The mother can have a repeated statement like, I can deliver a healthy baby. When the contractions will come, my baby will go down. My cervix will be dilating. So like that, some statements she can be practiced during the pregnancy time, and this can be carried throughout the pregnancy. Daily she can practice like hypnosis, and this will give her a good calmness, positiveness, and self-awareness. Main purpose of this is to stay calm, focused, and positive throughout the birthing process. So this can be done during the pregnancy, childbirth, and after the childbirth also. So here, affirmation or positive statement that challenges negative thinking pattern. If a mother is having fear, if the mother is having stress, she has some negative belief in her mind. Something will happen. First baby, what will be there? Whether it will be preterm or whether it will be the term. So whether my contraction will be normal, whether baby will get so much complications. So first mother will have so much anxious in her mind. So these all negative thinkings can be removed if she have a positive birth affirmation statements. So many studies, some of the studies published in American Journal of Obstetrics and Gynecology, the women who uses the hypnosis and the hypnosis affirmation, they have the lower incidence of cesarean sections and forceps delivery, vacuum delivery, and they can have the less chance of epidural analgesia also. Okay. Hypnobirthing affirmation main concept is for a calm and positive birth. So some of the statement you can see in the board, like, I trust that my body knows exactly what it's doing. During labor and birth, I am completely relaxed. I am completely cooperating with my body. I believe my baby's birth will come and quickly and easily. My baby is born with pure pleasure. I do not fight the birth in any way. My body is so much of relaxed. So you can read a different type of statement. These statements she can repeatedly practicing throughout her hypno childbirth classes, and this can be implemented in the childbirth period during the labor, first stage, second stage, and the third stage of labor. So so many affirmations how they can note. So these affirmations they can note and they can keep in their bedroom, or when they are going in the wards and all, we can keep it. By seeing that, the mother will be more motivated and they can read and they can keep in their mental image, and this can be visualized. For an example, like, I can do this, I feel safe, I let my uterus work in peace, I can give birth, I am excited to give birth, and I am excited to meet my baby. So I am surrounded by loved one, I am at peace, I trust my instincts, my body is working perfectly, my uterus is working perfectly, I am releasing fear and tension, I am open to the experience of childbirth. And we can make some hypnobirthing affirmation videos, some videos like music and all, they can make it, and this can be given in the childbirth classes, and they can be practices in home, or they can come to the classes and also they can practices that will help during the labor period. And birth affirmation cards are there, some cards they can make it. So in one card you can see, open up layer by layer, contraction by contraction, beautiful, gracefully, patiently welcome this lovely baby into the world. By seeing a flower or by seeing the words, no, by seeing the natural things, the woman will have the positive experience of childbirth. What are the main importance? This can help focus thoughts, channel and strength, and they can trust their own body. The pregnant women can trust their own body that I'm able to deliver a healthy baby in normal natural birthing process. And this mainly affirmation work on mind body connections. So when our mind is having a strong emotional stability, this will give a positive thoughts and emotion, and this will make a good physical health, and physiologically we are adjusting, and the pregnant mother can cope up during the delivery process. Mainly this will promote relaxation and reduces the stress and natural pain relievers, and this is a cost effective one also, and we can implement it for all the pregnant women during the labor period. So this affirmation mainly stay focused and centered during the childbirth, and helps to retrain the brain to focus on the positive aspects of childbirth. So whatever the negative myth or like that is there, that can be vanished, and the women will get a good positive experiences. So previously and all, going to the labor ward, the woman will fear, I'm going to get delivered, I will get pain, how my cervical dilatation will be. Maybe they don't know what they are going to do, primary mothers. So when they have this positive concept, anyway, I can able to deliver a good healthy baby. I can cope up. My body will adjust. My uterus will adjust. I can manage my pain. I can tolerate. This affirmation will help the woman during labor period. So important of birth affirmations, it remind the truth and give a good positive birth experiences. It replaces the common belief or misconception about the labor. Some affirmations for the natural birth, like I trust my ability to birth my baby. My body is intelligent and I can handle all the situation. My body will birth my baby safely and effectively. Birth is a supernatural occurrence. So God has created it in a natural way. It's a physiological thing. Don't make it as more complicated. As let it be, कितना अच्छा normally आ सकता है उतना अच्छा. As a midwife we will try our level best with all these painless modalities and make it a normal physiological birth. So what are the evidence-based benefit of birth affirmation? It reduces the anxiety and fear. It increases the sense of control. It increases the strength and endurance. It improved outcome. It enhances mainly focus on the delivery, and it increases the confidence for the mother. What are the guide to use affirmation? The pregnant women, they can use some of the affirmations like statement, I am calm, I am relaxed. So this they can be practiced regularly throughout the day-to-day life during the meditation, yoga, or wherever they are sitting. And this affirmations they can use during the labor time and keep in an open mind till they are getting a peaceful childbirth. How to use birth affirmation during term also, some statement, which statement they are feeling more confident and powerful about themselves, that affirmation they can take in their mind, and regularly they can practice along with the meditation exercise or during the relaxation period, and they can be implemented during the labor. So this affirmation will give calm, confident for delivering the baby. So this can be used in early labor, during the delivery and the labor period also. And in the postpartum period, like I'm a good mother, I trust my intents, I'm capable of handling my challenges, I'm taking care of myself. Some women after delivery, they will think everything completed. After expelling my baby, my work is completed. Not. She has to take care her baby. She has to leave her sleepless night. Always first 2 3 days, no, she can't sleep. Demand feeding. Whenever the baby cries, she has to feed the baby. Okay, so that all she has to accept herself. I am a good mother. I can take all care for myself and for the child. Next topic is visualization and visual focusing. So this is like guided imaginary. You have studied in your psychology, no? Like your psychology teacher, maybe she will tell, close your eyes. You are in the seashore. You are walking on the seashore. You are seeing Rajnikant, or you are seeing what Shah Rukh Khan. Deepika Pagodol is dancing. You are also dancing. So like that, some imaginary is there. So pregnant mother, what we will tell? You go, she can visualize her baby. You are handling the baby, you are holding the baby, you are kissing the baby, you are huddling the baby, you are feeding the baby. That only will give her more energetic and enthusiastic. Okay, I should welcome my baby. My pain and all will be relieved if I delivered when I am holding the baby. So that they can give an imaginary and focusing. So visualization is a great relaxation technique, and this can be used for many situations. And this can be taken in the childbirth classes and effective during the childbirth period. So this visualization they can, with all the senses they can use, like sight, hearing, taste, touch, and smell. So like that, all the five senses we can use in the visualization. So two types of visualization is there: outcome visualization and process visualization. Process means ongoing visualization. So during the pregnancy, the woman is doing the imaginary, guided imaginary, or like that. Outcome visualization will come at the delivery time, end of the childbirth. Steps for effective visualization: we have to set a goal that the women will achieve a normal, healthy delivery. Create a clear idea or picture and focus it often and give it positive energy for the women. So, guided imaginary can be done. So, they can put some visualization card in the labor ward, whatever the positive experience. Already, some women they have delivered, no, they have some good experience of the childbirth. Whatever the good experience that they can present in front of the pregnant mothers, they can put a videos or pictures. So, that all will have a guided imagination and a positive thinking for the pregnant mothers. So, like guided imaginary is there, visualizing goal is there, compaction, meditations are there. So, meditation based visualization goal, we can make some imagination in their mind by a trained person. They can do it, or they can put a TV or music or visualization card and a notice board. You know, we all knows about the notice board. So in that they can make some posters and they can paste all the pictures of childbirth, positive aspects of childbirth. By seeing that, the women will get mental image. Their mental image will be more positive and it will give a good experience on the childbirth. So how to practice visualization? We can use all the senses, and this imagination will be attached to our emotions, and the pregnant mother can daily practice during the meditations or in the wards like that, and the knowledge can be kept in their mind and it can be incorporated during their childbirth period. So if we are visualizing good images of childbirth and how we are taking care of the baby, the mother will be more happy, and that will be uh, projected in her labor period. So what are the visualization techniques and tools? Like vision, create a vision board, guided visualization meditations are there, index cards. You know, small cards are there, index cards. So we can keep some pictures or affirmation statements that can be seen by the mother and that can be give a positive imaginations. Picture and describe, utilize the exposure of the pregnant mother for a good image. So during the meditation, when she is lying down or she is doing some work, if they are going with some guided visualization, that will give a good mental image and this will give a positive childbirth. And this can be used in the labor period also. During the delivery time, we are giving some imagination, thoughts, feelings for the woman. Her pain level will be decreased and she will be more cooperative. Like madam have shown some pictures of labor room, how the labor room will be with mild music, with prevention of noise, है ना? So that all will give a soothing effect, and guided imaginary also will helps to reduces the painless during the labor, and that can be practiced throughout the pregnancy, and they can incorporate it in first stage, second stage, and this can be give a positive childbirth. And we in our India will future will see more normal physiological childbirth. Thank you.
Now it's started. Yeah, thank you. Thank you very much for this session. एक रील बहुत फेमस हुई है where a mother is telling the baby हाथ पकड़ के हमारे साथ में रघुनाथ तो किस बात से डरना सुना है that is affirmation ये विश्वास होना कि जो हम कह रहे हैं वो हो जाएगा that is affirmation ये सोचना उस पल में कि हाँ रघुनाथ हमारे साथ है that is visualization जो हम बात इतनी देर से कर रहे हैं साथ देने की दर्द को एहसास को कम करने की वही है ये सब कहीं हम जाते हैं कहीं भी फॉर एग्जाम्पल हम यहाँ बैठे हैं एक बहुत अच्छी सी भीनी सी खुशबू आ रही है अच्छा लग रहा है शांत लग रहा है अब हम बात करेंगे उस खुशबू की उस खुशबू के एहसास से दर्द को कम करने की ये वो दर्द है जो वैसे तो कभी कुछ करने से कम नहीं होता लेकिन हाँ ये दर्द होना भी जरूरी है वो दर्द ना होगा तो फिर जन्म कैसे होगा मगर जो हो रहा है वो कम से कम महसूस तो कम हो बस इसी रास्ते में एक और कदम है अरोमा थेरेपी for which I invite Renata ma'am, a senior midwife with more than 15 years of experience in her field. She is going to tell us about implementation of aromatherapy to reduce the pain.
Good afternoon, everyone. How are you feeling? Good. So today I'm going to talk about aromatherapy during birth. But first of all, I want to tell you how I came to this. It was very interesting, just very short presentation by one of the midwives who told us different ways of using aromatherapy during labor and birth. And she just passed a bottle of essential oils through us for, just to smell. And she was saying, okay, now you open this bottle, you smell this, and you will feel this way and this way. Then she passed another bottle through, and then she said, okay, now you'll feel this way and this way. And then she passed another bottle, and but all the group were like very silent. And then she passed the essential oils of eucalyptus, and then suddenly everyone started chatting, like became so enlightened, and then she said, okay, see, beforehand I was telling you the effect of essential oils, but now you can feel it on yourself, the effect of it. It's relaxing, it's opening, and it gives you pleasure. Yeah, so this was like first experience of essential oils for myself. And then I had the course. I trained myself to become more to have more knowledge about essential oils, and I started using it during birth for my laboring mothers. And of course, the effect I was seeing was amazing, and this inspired me to study more and more and to become a certified aromatherapist. Here you can see aroma lamp is going with some smells, which also is like orange and bergamot and eucalyptus, which helps to open your mind, which helps to be relaxed, which helps you to be opened. So just enjoy. And what is aromatherapy, first of all? It's like, when aroma does the impact on the body and the mind, and it helps to, it changes your perception of the world. But first of all, I want to say this disclaimer, which is very important when you start using aromatherapy in clinical settings, because it's not that simple thing. Yes, because aromatherapy, for aromatherapy, we use essential oils, and essential oils, they are derived from the plants. They are the live constituents of the plants, of different parts of the plants, and they are very strong, they are very potent, and they have like hundreds of chemical components, and that's important, to be knowledgeable about these chemical components before you start using this with your mother. So my disclaimer is essential oils during labor and birth process in clinical settings can be used only if it's in your scope of practice. So in India, there is no government recommendation yet to use it. It's not in the scope of practice. It can be used maybe in some private settings. And it can be used if you advise women to use it at home, but not in the clinical setting. So be very cautious about this, yes, before you start using it. Then you have to be trained by aromatherapist, and you have to have a clear protocol of a safe use of essential oils in your hospital. That is important because there are some side effects as well. If you use it wrongly, you can harm it, mother. Okay. So let me go a bit more, and just to explain that when you create the birthing environment, it's not only about this nice smell. Okay, so it's something nice smelling, so it helps to relax. No, actually, it's just a part of that environment you create for mother. It's with the dimmed lights, with the soft voices around, nice music, affirmations. All this together helps to create. And aromatherapy also is just a part of like supporting this environment. Yeah, it's not, you can't rely just and lean only on aromatherapy. It does magic, but you can't think that, okay, I'm using aromatherapy and everything will be all right. It's just a part of it, yes? It's a complex, okay? So essential oils, relaxing and uterotonic effects and safe use are proved by many researchers and published in the PubMed. So we have to use only those essential oils which already been tested and which are safe for pregnant women and which are safe for laboring women. Not all of the essential oils are safe, so be very, very careful. A little bit of history that the aromatherapy as a science started in France 1920s, last century, and there were some scientists that initiated was Mauritius Gettefosse, and he started it using for treatment, and then another doctor, they started using it as a therapy. And this is how this became like aroma and therapy. Beforehand, like in India, we know that it was used like for 10,000 of years, but it's not the same way and not the same derived essential oils, like we are using now. Because essential oil, which we are using now, They are derived by distilled way, distillation or cold expression. But for in aromatherapy, which was going around the countries in known, these aroma components derived different way, by different way. It's done? So there are some ways how you can apply essential oils to the mother. And the most easiest way is using aroma lamp. You put a few drops in it, and then you add some water, and this aroma goes around. But this method maybe might not be good to use in the clinical settings, because the other peoples might not be willing to have this smell, or maybe they have some allergy to to these aroma components. So that's why the preferred way is using only for the mother. So you can give her a drop into her palm, so she can rub it and then smell it from her hands, like this way. The other way is putting few drops on the cotton wool or the gauze, and then allowing mother to hold it closer to her. So then it will not go to everyone, it will be just directed to the mother. So how these essential oils reaches mother, and how they work. You can apply it on the skin, and this goes through the epidermis. The safest way to apply is the bottom of the sole or armpit or the back of the neck, avoiding face, and never these oils never should be applied on the body undiluted, because they are very concentrated, they are very potent, very powerful, and you can give a allergic reaction or burn the skin if it's applied directly. If you're applying on the body for massage or just for for body to absorb it, it should be diluted with the carrier oil. Carrier oil can be the olive oil, sunflower oil, some simple oils, but it needs to be diluted. The other way is inhalation, I already mentioned. So there are different ways during this, using this aroma lamp, or just directly inhaling from the cotton wool or from your hands. Never allow mother to use whole bottle and smell it from the bottle. It's not a safe way. How inhalation works, women has actually everyone has this olfactory nerve, which goes, the smell goes through the nose, reaches area in the nose, which is 2.2 centimeters with the smell receptors, and then they connected to the olfactory bulb nerve, which passes through the impulse to the limbic brain. So limbic brain is the primitive brain, and this where all the feelings and well-being, pleasure and content is controlled. And the limbic system directly linked to the hypothalamus, which is responsible for emotional and memory-evoked reactions to smells. Here is another very important part. we are trying not to use just one single essential oil. It's better to use combination of 2 or 3. So the smell, because this smell always triggers the memories. So we don't want some certain smell trigger mother's memory, and then maybe she had some bad memories with that smell. So for it not to smell, so it's better to use a synergy of 2-3 different oils. I already mentioned safe use is either massage, topical application, or inhalation. And just like if it's in the hands, so just 1 drop. If it's on cotton wool, 2-3 drops, not more than that. And if it's to be diluted in carrier oil, so 10 milliliters of carrier oil of sunflower or oil or coconut oil is very good also. Only 10 to 12 drops of essential oils to dilute it. Otherwise, it will be too strong. So it should be like 1 to 2% only. So the higher concentration can give opposite effect. Like lavender is known for its sedative and relaxation effect, or clary sage is known as a uterotonic. But if you use it too high doses, or if you use it for too long, it will give you opposite effect, and instead of relaxing and helping mother, she will become irritated, and then contraction can even disappear. So be very careful when you're using. And I said, like, ideally it should be the 3 essential oils, the combination synergy. You need to know what is the contraindications of using oils. So if woman is under 37 weeks of pregnancy, why is that? So this baby is still not matured, so we do not want to use any essential oils before baby is matured. So we do not recommend, and if mother goes into preterm birth, it's better not to introduce any oils during that time. If they properly control diabetes, because also some chemical components, we don't really know how they will affect mother's blood sugar, so it's better not to use it. And then epilepsy, severe cardiac disorder, history of current thrombosis, hypertension, preeclampsia, eclampsia, women having chemotherapy, current substance misuse. So what is the responsibilities of midwife? So to make sure there is no contraindications of using essential oils, check the expiry date on the bottle. Yes, everything should be written on the bottle. Take consent from the mother. Maintain hand hygiene. Do a test patch on the middle part of the arm. If there are any reactions, remove it with a carrier oil, not with water, as it will introduce it deeper into the skin. Observe for adverse effects. If like headache, itching, or skin rashes, shortness of breath, discontinue immediately and wind the air. Ensure the safe dosage and safe application. Store essential oils in a dark, cold place. Discard and use prepared essential oils. So sometimes you residual stays in the you might use it for the next patient. No, you always discard it. Wash your lamp with the soap and water, and only create the new set for your mother, for the new mother. Document, always document what oils you used for the mother. Discontinue using it at every 30 minutes and restart again after 20 minutes. So do it as a pattern. Never continue like 2-3 hours. Always make as a pattern. 30 minutes, 20 minutes break. Again, 30 minutes, 20 minutes break. So the most commonly used essential oils, and even in my practice, you don't need many. Lavender, clary sage, bergamot, frankincense, and peppermint. 5 essential oils is more than enough. And I just can say that lavender is for relaxation, antispasmodic, anti-inflammatory. Clary sage helps to stimulate contractions. Bergamot strengthens anti-anxiety, helps to relax. Frankincense, 1 drop into the palm to inhale during the stage when woman has a panic attack, helps to ground and calm down. And normally this helps also midwife and her birthing companion to calm down. So we give a drop into each hand, they rub, inhale, and then oral atmosphere improves. Peppermint, I love this when women having really strong pains. So I put it on the like cotton wool, 2-3 drops, and then she inhales directly from it. That really strong cooling effect. I call it brain freezer. It's like completely switches off her, thinking mind, and this helps her to reduce pain. Here are some recipes what you can use, but I'm not going to go into the details because it's a lot to say and it's not much time. And what are the contraindications? The clary sage, rose, and jasmine not to be used if mother had previous cesarean section, any 30 minutes after artificial or spontaneous rupture of membranes, not together with oxytocin or augmentation, if there is malpresentation, if there multiple pregnancy, or if there are any hyperstimulation, 5 to 6 contractions in 10 minutes. So this is the very important part, especially in India, because I could not find any good essential oil in India. I was trying to buy, but really they are all adulterated. The quality is not maintained, and just I found only one company, but I can't really advertise it, which really compiles all these requirements, what's supposed to be and how it's supposed to smell and what is the effect of essential oil. Because all the other ones, they are not good quality. And if you think that for 300-400 rupees you can buy a bottle of essential oils, this is a big mistake. They cost thousands of rupees and they are quite costly. If it's good quality, because you need like 50 pounds of rose petals to produce 1 bottle of essential oil. So if you think that you will buy for 1,000 rupees bottle of rose essential oil, this is the big mistake. Definitely, it will not be pure, or it will might be diluted or adulterated. So there are some precautions here. So never purchase it from Amazon. This is not a good place. Then there should be expiry date on the label, also country from where it was originated and manufactured method and the part of the plant. The bottle should be a dark glass blue or amber, not in a plastic. There should be a botanical name on it written on label. It should be clearly stated that it's essential oil, 100% certified organic, not diluted, and not a fragrance. People, they bring me some bottles and say, oh, this is essential oil, but actually it's a fragrance. Fragrance is not essential oil, the chemical just constituents. And if you have a chance to smell it, should give you a sensation of full spectrum deep fragrance. It shouldn't leave any oil residue on your fingers and should evaporate quite quickly. And just to summarize, that essential oils are generally very safe non-pharmacological method of supporting pregnancy, labor, and in postpartum period. Use of oils in labor can improve maternal satisfaction, reduce pain, stress, and anxiety. Normally, essential oils are well tolerated by laboring women. Less is more. Better to use less concentrated than too much. Care provider must be trained in the safe use of essential oils. She should be present at least 3 cases with an experienced trained aromatherapist before using aromatherapy on her own. Thank you.
थैंक यू वेरी मच मैम। अरोमा थेरेपी, खुशबू, वो कहते हैं ना, खुशबू को शौक बहुत है मगर मुमकिन नहीं हवा से रिश्ता भी करे। बस ऐसे ही कुछ खुशबू फैलानी है सिर्फ इन एसेंशियल ऑयल से नहीं, हमारे काम से। बस उस खुशबू से ही अपनी माँ को, उस मातृत्व को खुशी से महसूस करने की आज़ादी देनी है और करवाना है। ज़्यादा खुशबू की बात नहीं करते हैं क्योंकि अब खुशबू दाल के तड़के की और उस इलायची की आने शुरू हो गई है, एंड देन वी कैन प्रोसीड फॉर लंच। आफ्टर दिस लंच विल कंटिन्यू। ओवर टू यू।
So here is an interruption due to bad weather. So we are giving a lunch break now. So I request our delegates and panelists and all the participants to finish your lunch as soon as possible and come back here, and then we will continue with our panel discussion again. Okay, thank you.
hello, hello. Hello. Hello? Hello? Hello, hello.
No, exactly. We are from MP and settled there only. My husband got transferred here. अभी हुआ अभी हुआ
Hello, hello.
they would have taken from here now. Handed over here. So it's not working. It's not working.
So, welcome back. Hope you all have enjoyed lunch. वेदर भी बहुत अच्छा था, सबने अच्छे से खाया होगा, लेकिन सोना नहीं है, हमारा सेशन अभी भी चलेगा. Okay, so now we are resuming to panel discussion. So we'll continue with that.
Uh, am I audible to all? अच्छी आवाज है ना? So there was one discussion when while having food और वो सच दिल को एकदम छू गया. The scene is हम डिस्कस कर रहे हैं यहाँ पर पेनलेस मोडालिटीज के बारे में. ये वो बात हो गई कि हमें रसगुल्ला खाना है लेकिन वो मीठा नहीं होना चाहिए. इसकी जगह हमें कुछ ऐसा नहीं करना चाहिए कि वो नॉर्मल लेबर नॉर्मल ही रहे, पेनलेस या पेनफुल या हाई रिस्क या लो रिस्क ना होते हुए. लेबर शुड बी जस्ट लेबर. सो आज हम इसको सिर्फ पेनलेस ना कहते हुए हम इसे नॉर्मल लेबर कहेंगे, क्योंकि पेन इटसेल्फ इट्स अ पार्ट ऑफ लेबर. कॉन्ट्रैक्शन होगा तो पेन होगा. जैसा मैंने पहले कहा था, दर्द होना और दर्द का एहसास होना दो अलग चीजें. यहाँ हमने जितनी भी बातें करी, चाहे वो बात हो हॉट फर्मेंटेशन की, चाहे कोल्ड फर्मेंटेशन की, चाहे हाइड्रोथेरेपी की, चाहे विजुअलाइजेशन की, चाहे अफर्मेशंस की, या खुशबूदार अरोमा थेरेपी की। ये सब कुछ सिर्फ उस एहसास को कम करने के लिए, मगर यहाँ पर वो दर्द जो है वो एबनॉर्मल नहीं, वो नॉर्मल है। So coming back to the topic where we are learning different modalities to manage the normal labor to aid the process of giving birth. I'll continue the discussion. Looking forward to hear from Ruxana. Madam will focus on different modalities again to aid the process of labor. Ruxana, ma'am, over to you. You can take this mic or else. Yeah.
Very good afternoon to all of you, and I really appreciate our principal ma'am and director sir for giving this opportunity that we are presenting over here. And thank you to all participants, our students, teachers, for being a part of this conference. And I think सबने lunch कर लिया होगा. अच्छा, नींद तो नहीं आ रही? Okay. अभी यहाँ पे सब डिस्कशन हो रहा है पेनलेस मोडालिटीज फॉर नॉर्मल डिलीवरीज। यहाँ पे कि हम कैसे मदर्स को पेन तो एक सेल्फ जैसा मैम ने बोला कि पेन तो होना है, बट उसको कैसे कम किया जा सकता है इन द बाय गिविंग डिफरेंट टाइप ऑफ मसाजेस, aromatherapies, hydrotherapies, hot fermentations. So how we can reduce the pain to the mother? We can say client or patient or mother. Okay, all right. We can say mother. So massage. अगर किसी मदर या किसी को टच करते हैं, ऐसे हम कैसे बता सकते हैं कि मदर इज फीलिंग पेन और नॉट, और व्हेन वी आर गोइंग टू टच द मदर शी विल फील कंफर्टेबल, राइट? सो purposeful massage of the hand or other parts of the body also communicates caring. Massage takes the form of light or firm stroking, vibration, deep circular pressure. Stroking or rubbing the neck, shoulders, back, thighs, feet or hands in a effective pain relievers. Okay, अगर आपको पेन हो रहा है, हाथ पे हो या फिर पैर में हो या फिर बैक हो, हम मसाज करते हैं तो कैसा फील होता है? अच्छा लगता है, फिर हमें रिलैक्सेशन होता है, हमें अच्छा लगता है, फिर उस चीज को हम फील करते हैं, ठीक है? तो ये एक तो डाइवर्ट करता है पेन से और हमें रिलैक्सेशन रिलैक्स फील करता है। Here, receptors in the brain receive the sensation of pleasure from the massage, blocking reception of the painful stimuli of labor. ठीक है, जब भी हम किसी पेशेंट को मदर को टच करते हैं, मसाज देते हैं, ये स्ट्रोकिंग भी हो सकता है, रबिंग भी हो सकता है, हिप स्क्वीजिंग भी कर सकते हैं, और व्हाट इज दैट, शोल्डर, इसमें हम शोल्डर मसाज कर सकते हैं, नेक मसाज कर सकते हैं, बैक मसाज कर सकते हैं. सो मदर विल फील कंफर्टेबल एंड इट विल रिलीव पेन. Here, the supportive researches are there. Here the link is shared. Effectiveness of back massage in the first stage of labor pain among pregnant women. Link is here. In January 2020, published by European Journal of Translation and Clinical Medicine. Here the conclusion, what the thesis says, pain in the labor is nearly universal experience of childbearing women. Labor pain is a challenging issue for nurses designing intervention protocols. Back massage has a significant effect in reducing pain during the labor pain among pregnant women. This is proven by this thesis says when we are giving the back massage to the pregnant mother, she will feel relaxed and reduce pain. Second thesis, effectiveness of back massage on pain relief during first stage of labor in primary mother admitted at a tertiary care center. I have shared link below. What this thesis says, our study proved that back massage was effective in reducing pain during the first stage of labor, primary para mothers in comparison to those who were subjected to routine care. Second one. First, we are doing massage, and second is acupressure during labor. This is applying physical pressure to a specific point on the body is known as acupressure. Did you get my point? लग रहा सब सो रहे हैं. Okay. This may help induce labor by affecting your nervous system and muscles. ठीक है, इसमें क्या है कि एक पर्टिकुलर प्लेस पे हम प्रेशर्स अप्लाई करते हैं एंड दिस इज डन बाय स्पेशलिस्ट. ओके, so in this we can induce labor by affecting your nervous system and muscles. Here we can say labor is going on, we can induce the labor, but we are blocking, we are inducing, affecting your nervous system. We can see here. Is it visible? Okay. In first picture, we can see back massage is giving. And second one, we are zooming that sacral point. Here, we are giving the pressure that is done by a specialist. We can give over here, and mother will feel relaxed. She will feel relaxed when we are giving the pressure over there. And there is some pressure point where we can give the pressure to relieve pain. We can see in third picture, first one, that leg. Here we can give pressure to relieve pain. Second one, we can give on our palm here, so mother will relieve pain. And third one, we can see sacral area. We are giving pressure. And we can see in the fourth picture, in toes, we are giving the pressure to relieve the pain. And how to induce labor with acupressure? Here we are inducing the labor. Acupressure, here, in first picture we can see they are giving the pressure in particular point, so the labor will induce. Second, we are giving on palm, and third we are giving in the heel, and then again fourth, it's not visible clearly, and fourth we can see in the feet of finger. There is a one article, effectiveness of acupressure on level of pain and duration of labor among primary gravida mothers during first stage of labor. Here what this article says, it was determined that spinal point 6 acupressure was effective in reducing pain and duration of labor. So this is that. Here, first picture we can see. We are talking about this first in last one, this leg one. And third is food and fluid during labor. I think you might heard about most of staff doing they are not allowed to eat or drink during labor. Suna hai na? क्यों? क्योंकि बार बार वो वॉशरूम जाएगी, बार बार जो स्टाफ है उनको प्रॉब्लम होगी है, बट हमको ड्यूरिंग लेबर देना है, क्योंकि मदर अगर डिहाइड्रेट हो जाएगी देन वो जो एनर्जी हमें देना है, मदर को लगाना है ड्यूरिंग लेबर, वो नहीं प्रॉपर हो पाएगा. So we have to maintain nutrition. We have to maintain mother's nutrition level. So beverage, mother should stay well hydrated while laboring. Laboring women may have clear liquid such as water, juice, broth, ice, and Popeye. Here the thesis says effect of food intake during labor on obstetric outcome. Link is given below. We can say what it says. Conclusion: consumption of light diet during labor did not influence obstetric or the neonatal outcome in the participants, nor did it increase the incidence of vomiting. Women who are allowed to eat in labor have similar length of labor and operative delivery rates to those allowed water only. We have to allow mother to drink during labor, so we'll maintain their hydration and not feeling exhausted. Next is restricting oral fluid and food intake during labor. Why they are restricting? Link is given below. Author conclusions: since the evidence shows no benefits or harm, there is no justification for the restriction of fluid and foods in labor for women at low risk of complications. Thesis says we have to not restrict the woman to drink or eat during labor. We have to allow the woman to drink or eat during labor, so that the woman is not feel exhausted, not feel dehydrated. We have to allow the mother to drink plenty of water, juice. We can offer the mother. There is no evidence to support restrictions in the group of women. That's why we are saying we have to allow the mother to drink or drink during the labor. We can allow the mother to drink sips of water, juice, what is that? Coffee, not coffee, tea, whatever she want. We have to allow the mother, and also we have to allow the birth companion during the labor, and we have to teach. That's why we have to allow the birth companion from the antenatal period, so it will help in mother to keep informed about all the processes going on. So this is all about the massages and acupressure and the food and fluid during labor pain. Thank you.
Thank you very much, Ruxana. So, this acupressure points is not only aiding labor, but these acupressure points are also helpful in minimizing the menstrual cramps. So, are you aware about these points? So, first point is this. अंगूठा और इंडेक्स फिंगर के बीच में, राइट? अब आपको करना क्या है इसमें? व्हाट यू हैव टू डू इज इसको यहाँ प्रेशराइज करके यू हैव टू मसाज इट. ये मसाज हम क्यों करते हैं? यहाँ पर जितना ब्लड सप्लाई होगा वो उस प्रेशर पॉइंट को स्टिमुलेट करेगा और अगेन पेन को खत्म नहीं करेगा, उसके एहसास को कम करेगा. हमने एंकल पे 2 पॉइंट देखे. एक पॉइंट जो इनर साइड ऑफ एंकल है उससे 4 उंगली ऊपर, जस्ट जैसे ही 4 उंगलियां हमारी हर एक पर्सन की, मेरे लिए मेरी उंगली काम करेगी, आपकी नहीं, बिकॉज मेरा बोन लेंथ आपसे अलग है. सो 4 उंगलियों के ऊपर का जो पॉइंट, वहां पे आपको कंप्रेस करना है. अगर ऐसे समझ में ना आए तो ये वो पॉइंट है जहां पे पूरे पैर में सबसे ज्यादा दर्द हो रहा है. ठीक है? अगर आपने 4 उंगलियों के ऊपर पॉइंट को कंप्रेस किया और आपको उस वक्त वहां दर्द नहीं हो रहा है, तो ये समझ लेना कि आपने गलत पॉइंट किया. वापस आप अपना जो हाथ है उसकी पोजीशन चेंज करके वापस वो पॉइंट फाइंड आउट करके उसे मसाज करेंगे. सेकेंड पॉइंट है आपकी जो एड़ी है, एड़ी और टखने के बीच का जो हिस्सा है, वहां पे आपको एक नॉच सी फील होगी, एक गहरापन फील होगा। बस उस हड्डी के पीछे वहां उस नॉच को आपको मसाज करना है। ये आपका दूसरा पॉइंट। तीसरा अब बात करते हैं हमारे हथेली के, दिस पार्ट। ठीक है, ये वो पार्ट है जो कि आपके डाइजेशन के लिए भी जरूरी है, आपके ब्लोटिंग के लिए भी जरूरी है, आपके मेंस्ट्रुअल क्रैम्प्स के लिए भी जरूरी है, लेबर पेन के लिए भी जरूरी है। ये जब आप इसे मसाज करते हैं, तो अगर आप एक्यूप्रेशर का वो देखें, मैप देखें, तो यहाँ पर आता है आपका इंटेस्टाइन। ठीक है, इसीलिए यहाँ पर हम मसाज कर रहे हैं, क्योंकि जब वो रेगुलेट होगा तो अल्टीमेटली आपका मेटाबॉलिज्म बूस्ट होगा और वहां पर जो एसोसिएट फैक्टर्स हैं जिसकी वजह से पेन बढ़ रहा है वो कंट्रोल होगा। देन हमने एक और मसाज में हमने एक साइड बताया था जो कि पैर का ये वाला साइड है, यानी जब हम चप्पल पहनते हैं तो चप्पल पे साइड में बाहरी तरफ जो हिस्सा आता है, दैट इज कंसिडर्ड टू बी रिप्रेजेंटिंग अवर वर्टिब्रा। सो लेबर का पेन सबसे ज्यादा कहां पर होता है? सैक्रम पे। बैक पेन से ही शुरुआत होती है लेबर की, राइट? सो जब हम मसाज कर रहे हैं उस पार्ट को, तो हम ऐसा फील करें, हम ऐसा सोचें कि जब हम मसाज कर रहे हैं तो हम अपनी वर्टिब्रा को मसाज कर रहे हैं, उस पेशेंट की वर्टिब्रा को मसाज कर रहे हैं। एंड द नॉच विच एंड्स, द पॉइंट वेयर द वर्टिब्रा एंड्स, दैट इज द सैक्रम, दैट इज द सैक्रल पॉइंट ऑन आवर फुट। सो जितनी भी चीजें हमने अभी यहाँ डिस्कस करी, ये सब कुछ उस प्रोसेस को आसान करने के लिए है। हम यहाँ आज सब इकट्ठे हुए हैं, इतना जो 2 दिन से 3 दिन से डिस्कशन हो रहा है, वी आर जस्ट सेलिब्रेटिंग द मदरहुड। ये सिर्फ और सिर्फ मातृत्व का आघोषण है। किसी ने बहुत अच्छा कहा है, when we were doing this breastfeeding week celebration and all, so यहाँ पर अब ये पॉइंट आ गया है कि अब हमको ये डे सेलिब्रेट करना पड़ रहा है कि ब्रेस्ट फीडिंग को वर्किंग मदर्स के लिए हम इजी बनाएं। सच अ पिटी, वी नर्सेस आर द वन जिनको सबसे पहले अपने बच्चे को वीन ऑफ करना पड़ता है, बिकॉज वी कैन नॉट कैरी अवर बेबी टू द हॉस्पिटल्स, राइट? अगर हमें वीन ऑफ करना ही है, why not go for expressing out the breast milk? Why not go for storage of the breast milk? Why not go for the banking of the breast milk? इन्हीं मोडालिटीज को तो हमें और ज्यादा इंप्रूव करना है, और ज्यादा इसके बारे में सबको जागरूक बनाना है। दवाइयां देने से बेहतर ये नहीं है कि हम अपने बच्चों को वैक्सीनाइज करें, उन्हें वैक्सीनेशन दें। किस फॉर्म में? By giving the colostrum, by giving the breastfeed. Why should we introduce all the microbes which are not good for the baby in the form of bottle feeding or any form of formula feeding? वहां उस फॉर्मूले की दिक्कत नहीं है, जिस तरह से हम उसे बना के दे रहे हैं दिक्कत वहां पर है। ये किसने सिखाया है प्लास्टिक की बोतल को बॉईल करना? ये किसने ज्ञान दिया? आपने एक बार उसमें गर्म पानी ही डाल दिया तो आपने कितने सारे माइक्रो प्लास्टिक मॉलिक्यूल्स उसमें छोड़ दिए हैं। इस कंसेप्ट को कौन दूर करेगा? ये कौन समझाएगा? और क्या वो प्लास्टिक की बोतल मां को रिप्लेस कर सकती है? कर रही है, मगर क्या सभी तरह से रिप्लेस कर सकती है? हमें पता है नहीं कर सकती, तो हम क्यों नहीं दूसरों को सिखाएं? ये वर्कशॉप, ये कॉन्फ्रेंस, इतने सारे रिसर्च, इतने सारा डिस्कशन, इतने सारे स्पीकर्स दूर दूर से आए, इन्होंने इतनी सारी चीजें बताई, ये तब तक इफेक्टिव नहीं होगा जब तक कि हमारे नर्सिंग स्टूडेंट्स जाके उस फील्ड में ये भूले बिना कि हम नर्स हैं, चाहे हम पीएचडी हो, चाहे हम जीएनएम हो, चाहे हम एएनएम हो, चाहे हम एमएससी हो, क्रिटिकल केयर हो, मेड सर्च हो, व्हाटएवर, वी आर नर्स फर्स्ट। हमारे तो लाइसेंस पे लिखा रहता है रजिस्टर्ड नर्स मिडवाइफ, फिर हम अलग कैसे हो गए? देयर आर मेनी स्टूडेंट्स हु सेड मैडम हमारा तो टॉपिक नहीं है, दिस इज नॉट रिलेटेड टू आवर टॉपिक। how can you be a nurse without this topic? ये सारा डिस्कशन, ये सब कुछ तभी इफेक्टिव होगा बच्चों जब आप लोग जाके अपने फील्ड में इसके लिए काम करेंगे। ये मैजिक आप ही ला सकते हो। हम उस जगह से अब आगे आ गए, अब हम आपको सिखा रहे हैं, हम आपको बता रहे हैं। हमारा सिखाया हुआ कितना अच्छा है ये तो तब पता चलेगा कि आप कितना प्रैक्टिस कर रहे हैं, राइट? सो ज्यादा टाइम ना लेते हुए I'll end this session and thank you very much to all the speakers to contribute in this panel discussion. Looking forward more and more towards a better world for the mom and the baby. Thank you. Thank you once again.
Thank you very much to our moderator, Dr. Neeta Rajesh Bhide ma'am, and our panelist, Ms. Renuka GB ma'am, Nima Bhaskar ma'am, Renata ma'am, and Ruxana ma'am. We'll be very much cleared about the things I think now, है ना? हम लोग क्लियर हो चुके हैं, बहुत सारी चीजें हमें समझ आ चुकी हैं। जो भी हम में थोड़ी बहुत कमी तो है ही, हमें इतना सारी चीजें नहीं पता था जो आज मैम लोगों ने हमें समझाया। क्या ये हेल्पफुल था सबके लिए? इंटरेस्टिंग भी रहा है ना? ओके, सो थैंक यू मैम फॉर शेयरिंग योर ग्रेट नॉलेज विद अस। थैंक यू।
Moving towards our last session of today, I would like to welcome and invite Dr. Suraj Kumar, Sir, Professor, Center of Physiotherapy and Rehabilitation Sciences, Jamia Millia University, New Delhi, to present his session on kinchotapping in dysmenorrhea. Sir, please.
Hello, respected Director, College of Nursing, Principal, College of Nursing, Upasthit, faculty members, students. I have started my journey from this institute in 2000 as a lecturer, and that time this institute was as a farming place. Mean that time यहाँ पे खेती होता था. So उस समय से मेरा यहाँ से जुड़ाव है, और आज लेक्चरर यहाँ से स्टार्ट करने के बाद मैं इस समय प्रोफेसर जामिया मिलिया यूनिवर्सिटी, सेंट्रल यूनिवर्सिटी न्यू दिल्ली में हूँ. और ये 3 दिन का जो वर्कशॉप आपका चल रहा है, इसको सुनकर मैं बहुत उत्साहित हूं कि आप लोग को इस तरह का वर्कशॉप बाबा इंस्टीट्यूट ऑफ नर्सिंग में शुरू है. हमारे समय में यहाँ शुरुआत हुआ था, सबसे पहले जो वर्कशॉप इस तरीके का, उसका नाम एकेडमा रखा गया था. आई थिंक मैडम एकेडमा रखा गया था. सो दैट टाइम आई वाज स्टार्टेड इन द फॉर्म ऑफ एकेडमा, and today it's converted into international workshop or conference. That's good, for wonderful for this institute. So today topic is effect of kinesiotaping in dysmenorrhea, and basically this is a research paper. I have done a research work on kinesiotaping in our university. I am as a principal investigator for this research work, and this research work funded by the university itself, along with the one gynecologist professor at university. So next slide करिएगा जरा. ये अच्छा दे दीजिए. So basically dysmenorrhea is a cramping pain in lower abdomen and pelvic during the menstruation, as you all know, and it is the most common gynecological problem in all ages, and it's racial women, especially for the college student or school going students. So it is a basically very painful condition, and in this painful condition it is observed that about 1/3 of the women experience as a moderate to severe pain in their lifetime. Approximately total 90% of the women suffering from this kind of pain, and among that severe pain, quantity of pain, intensity of pain, 40% have severe pain. So this is very challengeful for us professional or medical professional, so that pain can, how can we rectify for the women. And dysmenorrhea can be primary or secondary, as you all know, which does not have any underlying pathologies, while secondary dysmenorrhea could be due to the underlying pathological causes such as endometriosis, adenomyosis, uterine myoma. And in young women, primary dysmenorrhea is often observed and experience pelvic or lower abdominal pain, which lasts about 48 hours from starting of menstruation. Beside pain, some of them experience their symptoms such as diarrhea, constipation, nausea, vomiting, migraine, dizziness, and fatigue. And dysmenorrhea can be significantly affect the woman, its quality of life also. But how to control this menstrual pain? In the conventional day, most of the women depend upon the medication to cope up with the menstrual pain, which may result the drug abuse. And the second thing, sometimes alternative therapies that include the vitamin supplementation, transcutaneous electrical nerve stimulation. Actually, this TENS is very useful, as the madam says in the previous lecture, the pain gate theory. The pain gate theory, best treatment for this by this modality, TENS, and acupressure, massage therapy, and exercises. However, result of these therapies were short-acting and time-consuming. But by this kinesiotaping is a technique that is based on the body own natural healing process and used for elevating pain in any region. So this study focuses on such taping technique which is both cost effective, time effective in managing menstrual pain easily and conventionally, rather than the use of the medication and other therapies. So basically this study was approved by the Institutional Ethics Committee as the research protocol, and this research is also registered in CTRI registration. And how to enroll this and recruitment of the subject. This study was conducted at the Department of Obstetrics and Gynecology in association with the Department of Physiotherapy. And this is a single blind randomized controlled trial. Total of 115 subjects were taken. From the OBG outpatient department, where screened out the 66 subjects were satisfying inclusion criteria, and the rest of them were excluded. So in group A, that is control group matlab medication group, and the group B is experimental group, in which we have applied the taping. So this is nutshell of the subject allocation. So in one group, that is medication group, 32 subjects were completed the study, and taping group, 34 subjects completed the study. So intervention, female of age group 18 to 30 years, that is Nali Gravida, and patient willing to participate with the confirmed diagnosis of primary dysmenorrhea, conscious and coherent, and having regular menstrual bleeding are included in this study. In group A, single day dose of pain relieving medication containing diclomine and mefenamic acid administered 3 times a day for 4 days. And in group B, kinesiotaping is applied for 3 days, satisfying for the day. So technique is basically the subject is made to be supine lying on the treatment couch with the proper screening for privacy, and kinesiotape is applied to the abdominal and lumbar area, a piece of kinesiotape. This is basically kinesiotape. 5 centimeter in width and 8 centimeter long is applied below the umbilicus and stretched down to the pelvic line, to the pubic line, where the pubic hair begins, and another piece of tape 5 centimeter in width and 10 centimeter in length is applied horizontally to make a cross shape with the first one with the minimal stretch. Then patient is made prone. A tape width 5 centimeter and length is 6 centimeter applied horizontally on the spinous process of L5 lumbar vertebra. So during the study, basically in both group, age of menarche duration of menstruation, and number of sanitary napkins, weight, height, body mass index, blood pressure systolic, blood pressure diastolic, all bear in similar for both the groups. And the result were there's their study improvement in both group in pain and functional independence, but experimental group demonstrated higher GPS score which compared to the control group. Control group मतलब medicine वाला group. However, the result are not statistically significant, माने बहुत ज्यादा difference तो नहीं आया, लेकिन कुछ अच्छा हुआ rather than the medicine वाले group से after application of this kinesiotaping. So this is basically, in this study we analyzed the effect of kinesiotaping on dysmenorrhea in nulli gravida women. When compared to the medication, both groups showed significant improvement in terms of pain and functional independence, which was assessed by GPS scale. GPS scale में basically 33 total scores होते हैं, 100 marks का होता है ये. So in comparison of drug, taping is cost effective. In the net cost per session is lower in taping technique, and hence it is economical also. Kinesiotaping is a non-chemical tape that stimulates the electromagnetic energies of the bodies, which heals naturally and maximizes the natural body healing mechanism. From the previous researches, it is understood that taping promotes relaxation of the muscle, increases lymphatic and vascular flow, and reduces pain. So kinesiotape includes constant relaxation and contraction of the muscles by stimulating the cutaneous receptors and thus elevating the pain, which can be explained by neurofacilitation effect, where there is a constant relation between cutaneous afferent stimulation and motor unit firing. Kinesiotaping also elevates pain by stimulating tactile fibers in the skin through the pain gate mechanism. The tape applied at the lower abdomen stimulates the tactile fiber, which could inhibit the pain sensitizing action and prostaglandins of this spinal cord. So, conclusion of this study, from the result attained, the study concludes that the kinesiotaping elevates pain due to the primary dysmenorrhea and improves functional independence. It is recommended over drug therapies as it is cost effective, less or no side effect, easy to self-administrable, and minimal contraindication that suit most of the women and does not require medical professional supervision for application. This is all nutshell about this kinesiotaping, and actually this kinesiotape is basically approximately 300 cost, and through this kinesiotape you can apply 10 times, means 10 months. In 1 month, 3 times, 1 day करके 3 बार लगाना पड़ेगा, और very much effective of this tape also. So anyone can take practical. Actually, during the research work, my student was applying on this tape. I am only the principal investigator that time. If anyone can apply, you can take and make practical also. कोई करना चाहते हैं? आपस में भी कोई कर सकते हैं. हाँ, वो तो मैं बता दूंगा, जो करेंगे उनको मैं बता दूंगा. अगर कोई बॉय आ जाएंगे उनको भी कर दूंगा, उसमें क्या है. या नहीं करना है तो कोई नहीं, बाद में आप लोग करेंगे. नहीं आ रहा था। कोई बात नहीं, आप लोग प्रैक्टिकल कर सकते हैं, इसका वीडियो भी ऑलरेडी है। आप जब गूगल में खोलेंगे तो इसका वीडियो भी मिल जाएगा, इसमें लिखा हुआ भी है। आपके टीचर को मैं एक्चुअली ये दे करके भी जाऊंगा, उनको वो भी बता देंगे आपको। थैंक्स अ लॉट।
Thank you, sir. Thank you so much for imparting your knowledge with us. Despite of your busy schedule, you came here for us and enhances our knowledge regarding kinesio tapping, as this is not very much aware in people. अभी भी सभी लोग इतना ज़्यादा अवेयर नहीं है इस टॉपिक के लिए, सो इस इंफॉर्मेशन के लिए आई एम एक्सट्रीमली डिलाइटेड एंड आई एम एक्सट्रीमली थैंक यू सर. With this, we came to the end of our session, and now we are moving towards our paper poster presentation. Although we got so many research paper, but because of our hectic schedule and with the shortage of time, we selected only 4 papers for presentation. Firstly, I would like to request our scientific paper evaluators, Dr. D. Vaskaraj Sir, Principal College of Nursing, Ambedkar Nagar, to step forward on the front seat of the sofa for evaluation. Sir, please. Secondly, Mr. Nitin Soni Sir, Professor, Baba College of Nursing, to occupy his seat on the front desk of sofa. Thirdly, I would like to request Mr. Gagan Verma, Sir, Associate Professor, Baba College of Nursing, to occupy his seat on the front desk of sofa. And lastly, I would like to request Mrs. Anjali Chaturvedi Ma'am, Assistant Professor, Baba College of Nursing, to occupy her seat. Dr. Suraj sir has to leave, so I would like to request our principal, Professor Dr. Archana Chauhan ma'am, to present sir a memento and certificate. Sir and ma'am, please. Thank you, ma'am, and thank you, sir. Thank you so much for your time.
So moving forward, so now I would like to invite Ms. Sushmita Chaudhary from Indore to present her scientific paper. Ma'am, please come.
No issues. You'll do some ringing or bell? No. After 10 minutes? A very good noon to all the dignitaries present over here, especially Principal Ma'am, Baba College of Nursing, respected Neeta Bhide Ma'am from Indore, and all my dear colleagues and dear students present over here. I am Shushmita Chaudhary. I am assistant professor in Maharshi Vasisht Autonomous Medical College, Basti. I am going to present my paper here. So, mankind has experienced pain since the beginning of the time. According to the definition of International Association of Pain, pain is an unpleasant mental and emotional experience which is accompanied with tissue damage. One of the most severe pain known to human is labor pain, which is synonymous with parturition. During delivery, excessive pain leads to fear and anxiety. Generally, there are two options for pain relief during labor and for augmentation of labor. These use pharmacological and non-pharmacological methods. Pharmacological methods are found have adverse effect on both fetus and mother. Reflexology is an ancient, mild, and non-invasive technique used widely as one of the non-pharmacological methods for pain relief and augmenting labor without any side effect on both fetus and mother. Need and significance of this study was pain is inevitable, suffering is optional. Cyril Tuttle Ross. Birthing is a painful process. The body is designed for it, and we will make it comfortable as possible. Morrison Susan Jane. A study conducted by Jasbinder Kaur in 2013 in Punjab Institute of Medical Science showed that cesarean section rate that was 65% that was found to be higher than vaginal birth, that is 35%. Many women believe that C-section will relieve their labor pain. However, it is seen complication of C-section was very much as infection, pulmonary embolism, longer hospital stay, etc. Then Init MC Callum said that reflexology is an ancient art which provides relaxation and comfort. It involves applying pressure to specific points of feet, and that is associated with various organs of our body. During labor, mother suffers from unbearable pain for which they need an alternative pain relief method. Reflexology is found to be safest and economical way to reduce labor pain. Therefore, the investigator decided to take up this research project. Then problem statement of my study was a quasi-experimental study to determine the effect of foot reflexology on pain intensity and duration of labor among primary gravida mothers admitted in labor room at selected government hospital of Indore during the year 2017 and 18. Objectives were to assess pre and post level of pain in primary gravida mothers during first stage of labor in both experimental and control group, to assess the labor duration 5 centimeter to full dilatation of cervix in primary gravida mothers during first stage of labor in experimental and control group, to evaluate the effectiveness of foot reflexology on pain perception in primary gravida mothers during first stage of labor in experimental group, to compare labor pain intensity in primary gravida mothers of experimental group and control group, to compare labor duration in primary gravida mother of experimental and control group, to find out association between the levels of pain in primary gravida mothers during first stage of labor with their selected demographic variables. Hypothesis. All the hypotheses are tested at level of 0.05. Hypothesis 1 was there will be significant difference in pain scored in primary gravida mothers during first stage of labor in experimental and control group. Hypothesis 2 is there is a significant difference in duration of labor in primary gravida mothers during first stage of labor between experimental and control group. And hypothesis 3 was there is significant association between level of pain in primary gravida mothers during first stage of labor and their selected demographic variables. Review. I will read only one review. This READY NP 2012 conducted a quasi-experimental study to compare efficacy of acupressure and reflexology in reduction of labor pain. Then the study was conducted in obstetrics and gynecology ward of hospital in Bangalore. Sample with random sampling technique were selected and 2 intervention group were made. First intervention group with reflexology and second with acupressure. Both groups received 2 interventions for 30 minutes. Pre-test pain assessment and post-test pain assessment was done with visual analog scale. The study result revealed that reflexology is more effective than acupressure in reducing labor pain perception during first stage of labor. Methods and procedures used in my study are: research approach is quantitative, research design is non-equivalent, control group design. Setting was selected government hospital Indore. Population was primary gravida mothers in first stage of labor with 5-6 centimeter cervical dilatation. Sample 20 primary gravida mothers in each group fulfilling sample criteria. Then sampling technique was purposive sampling technique with alternate method. Tools were structured tool, demographic data of mother, then numerical pain rating scale. Third one was simplified WHO partograph to determine duration of labor. Then, in socio-demographic characteristics, finding related to socio-demographic data reveal that experimental group out of 20, 17, that is 85%, belong to age group of 20 to 25, whereas in control majority, that is 80%, were in between 20 to 25 years of age. Regarding family income, in experimental group, majority of subject had monthly income of 10,000 to 15,000 per month. And as well as in control group, majority of samples were having 10,000 to 15,000 income per month. Then educational status in both the group, that was nearly same, that is 20 sample, 50% had primary education. In control group also 9%, 9, that is 45% have primary education. Regarding occupation, in experimental group 70% were homemaker, and in control group 65% were homemaker. Then about religion shows that in both experimental and control group, majority of samples, that is 75% in experimental and 70% in control group, were Hindus. Then regarding admission, in both experimental and control group, majority of subjects, that is 90% in experimental group and 85% in control group, were booked. Then regarding antenatal visit, 50% had visited antenatal clinic more than thrice. In control group, only 55% had visited antenatal clinic more than thrice. Then description of level of pain, that is table is showing frequency and percentage distribution of level of pain, that is pre and post test with routine care and therapy, that is foot reflexology among primary gravida mothers in control group and experimental group. Then in this moderate in control group, 65% were having, that is majority were having moderate pain, as well as in experimental group also majority were having moderate pain, that is 65%. Then after 0 hour of this therapy given by me, 20% were having moderate pain, whereas 80% were having severe pain in control group. But in experimental group, moderate pain, that is 55% were having moderate pain, and 55% were having severe pain. Then after 1 hour of therapy, 5% were having moderate pain in control group, and 95% were having severe pain in control group. Then in experimental group, 30% were having moderate pain and 70% were having severe pain. Then effectiveness of foot reflexology was shown by significance of the in experimental group, mean was found to be 4.25 during pre-test, and during post-test at 0 hour, that was 6.35, and at 1 hour, that was 7.30. Then standard deviation was calculated, that was 1.68, 1.23 and 1.45 respectively. And then table value was seen at degree of freedom 19. So the calculation was 6.04 and at 0 hour, and at 1 hour 7.61. So very good significance was found. Then table 3, that is showing comparison of pre and post test scores of level pain intensity among experimental and control group. Then in previous pain score, in both the group there was no significance found, and in post test pain score, that is at 0 hour and at 1 hour, significant difference was found as calculation was done. That is mean 6.35, 7.75, at 1 hour 7.30 and 9.15. Then table 4 showing frequency and percentage distribution of duration of labor, that is 5 centimeter to full cervical dilatation by simplified WHO partograph. The frequency and percentage are shown here. I have calculated, I have not calculated in hours, I have taken it in minutes. That means 240 to 300 minutes, that is 4 to 5 hours. Majority of samples were having duration of labor from 240 to 300 minutes, that is 65% in control group and 70% in experimental group. Then 301 to 360 minutes, that is 5 to 6 hours. Control group, 20% of the control group were having duration of labor this month, that is 301 to 360 minutes. And in experimental group, only one mother was found to be having the labor duration 5 to 6 hours. Then here also in experimental and control group, mean was calculated, and the table value shows t-test, pair t-test shows that 2.476 value was calculated. That means significance was found. Then conclusion: the most joyful experience in women's life is giving birth to a child, but undeniably it is most painful one. Labor pain is pain which is unavoidable, as ma'am has said, for any women during their birthing process, but then it can be reduced or minimized with many non-pharmacological method without any side effect or harms either to baby or to mother. This study reveals that foot reflexology is one of the alternative methods which is accepted by mothers to reduce labor pain perception and minimize duration of labor among primigravida mothers without any risk of stopping the contraction. Hence, midwives, mothers, and their birth companions must be taught about foot reflexology so that use of medical intervention for reducing labor pain may be minimized and thereby providing positive birthing experiences to mothers. Implications in nursing research: this particular study may be used as evidence of review on the basis of which more researches can be done. For nursing personnel, it may act as evidence-based practice to use foot reflexology as pain relief method. The present study will motivate other researchers to conduct similar study on large scale. The study may be conducted in rural and urban settings. A study may be conducted on any parturient mother to see effectiveness of foot reflexology. Other than pain intensity and duration of labor, parameters may be taken as variable for new study to be conducted. So references are, I have taken the data and all the things from books, dissertations, and online periodicals. Thank you so much.
Good afternoon, on and all. Any questions from floors? Any audience? You have any queries about studies?
Yes, sir, I am having.
Please.
Ma'am, this side. Yes. I just want to know about the pilot study. Means in your pilot study, you have taken how many number of sample? 5 for control and 5 for experimental. Because your ये sample size जो है आपका मुझे लग रहा है काफी small है. ओके ओके तो आपने जब पायलट स्टडी अपनी की थी 5 सैंपल्स पे जो आपने बताया, लाइक 5 फॉर एक्सपेरिमेंटल ग्रुप एंड 5 फॉर कंट्रोल ग्रुप, तो उस टाइम आपका जो पायलट स्टडी थी वो रिलायबल थी क्या? कितना आई थी रिलायबिलिटी? व्हाट वाज दैट?
Ma'am, it was reliable at 0.05.
105.
0.05. I think, ma'am, I have forgot. I have to see again, I think. I
Okay.
forgot, sorry, ma'am. Yeah,
Okay.
I have done it back.
First thing, it's good that you have done this study because ultimately you have done a favor to the mother, helping her for her normal delivery.
Thank you so much,
So,
ma'am.
one thing is that there's no correction or any question to you. Always, when you are having a smaller sample size, you cannot just generalize your findings. So, that is the only drawback. But
Okay,
then
ma'am.
this thing can be extended for a
Okay.
longer time. You can continue with this study. If your 30 samples were there, take it as your pilot and go for a bigger sample, and then you this study you can again publish.
Okay,
Fine,
ma'am.
30 also you can publish, and then further increasing sample also you can put. Another thing is there's no homogeneity. Your pilot was on a different setting, and then your main study was on a different
Yeah,
setting.
yes, ma'am.
So there's no homogeneity. So now again, if you're going to go further with this study, try to make it homogeneous.
Okay, ma'am.
Procedure is fine.
Okay, ma'am.
This
Thank
point
you.
will be there.
Thank you so much, ma'am.
Thank
Okay,
you, ma'am.
ma'am. Thank you so much.
Thank you, ma'am.
Okay, thank you.
Thank you so much, sir.
Thank you, ma'am. Now I would like to call Vishnu Prakash, Associate Professor, TSM College of Nursing, for our second paper presentation.
Good afternoon, respected dignitaries and delegates over present here. And thanks for giving this opportunity for presenting my research paper in international conference. And I would like to start with my research paper problem statement. The problem statement is a study to assess the effectiveness of structured teaching program on knowledge and practice regarding incisional hernia and its prevention among the clients between the age group of 21 to 60 years who underwent abdominal surgeries at Mamata General Hospital, Khammam, Telangana. And objectives of the study is to describe the socio-demographic variables of the clients and to assess the levels of pre-test knowledge and pre-test knowledge and practice regarding incisional hernia and its prevention among the clients. And third one, that to assess the effectiveness of structured teaching program on knowledge and practice regarding incisional hernia and its prevention, and to associate the post-test knowledge and practice scores with their selected socio-demographic variables of the clients regarding incisional hernia and its prevention, and to develop and distribution of an information booklet regarding incisional hernia and its prevention. So here I given one slide regarding introduction, that is Surgery is the medical specialty that treats the disease and injuries or other physical conditions. And surgery came from Greek word that is chirurgia, meaning that handwork. And India, Sushruta Samhita is also known as by the title father of surgery. And Bilruth is the father of abdominal surgery. He had gone the first abdominal surgery in the 1881, that is gastrectomy. And surgery is major event in any person's life. Good results of the surgery depends on careful preoperative evaluations, balancing the risk and benefits of the surgery and attention to pain management and avoidance of post-operative complications. So you can see the need for the study. Why I taken this study? You can see the incidences. So worldwide, there is a 1 million abdominal surgeries, abdominal wall hernia repair walls are performed each year. So in that, in 1 million cases, mostly the male ratio is highest than the females, and approximately 25% of the males are having incisional hernia who underwent abdominal surgeries. And you can see the graph also here. So more than 1 lakh men and women and children in India undergone surgery for ventral hernia repair, and each year at least 60 to 70% of abdominal operations are leads to an incisional hernia, and thousands of abdominal operations are annually performed that leads to a large number of incisional hernia. So you can see the diagram. So in bar diagram I mentioned that incisional hernia is having highest percentage in who are underwent abdominal surgeries. And when comes to the hypothesis, so hypothesis I mentioned regarding, one is for STP, another one is significance of association. So first one is there will be an increased knowledge and practice levels of the clients regarding incisional hernia and its prevention after this structured teaching program. And there will be an association between post-test knowledge and practice course of clients who underwent abdominal surgeries regarding incisional hernia and its prevention with the selected socio-demographic variables. And limitations is the clients, the age group of 21 to 60 years, and clients who are underwent selected abdominal surgeries in wards at Mamata General Hospital, Khammam, Telangana. And the period of study is 6 months and sample size is 60. And methodology. Research approach is quantitative evaluative approach. Research design is a pre-experimental design, and variables of the study is independent variable and dependent variable. An independent variable as is structured teaching program, and dependent variable is knowledge and practice. And setting up the study is, the study was conducted in surgical and OBG wards in Mamata General Hospital, Khammam, Telangana. Because OBG wards are taken because there are many cases who are underwent LSCS, lower segment cesarean section. So for that also there is a chance to develop incisional hernia. So that is the reason I taken OBG wards also for my study. And population who underwent selected abdominal surgeries, and sample the clients between the age group of 21 to 60 years who underwent abdominal surgeries, and sample size is 60 clients, and sampling technique is convenient sampling technique. And criteria for sampling selection is who are between the age group of 21 to 60 years and who are underwent abdominal surgeries like laparotomy and cesarean section, and who are willing to participate in the study, and who are available at the time of data collections, and who can understand and speak Telugu and English. And exclusive criteria, who are not admitted in the Mamata General Hospital, Khammam, Telangana. And method of data collection is interview technique, and tool for the data collection is structured interview schedule. And when goes for the pilot study, I taken my sample size is actually 60. Apart from 60, I taken 10th percentage of sampling is 6 sample I taken in for pilot study, and I conducted, and the pilot study got getting reliable and applicable and feasible. And after by conducting pilot study, my reliability also 0.97. It is significantly, that is the reason I proceed for the data collection. And the data collection, I taken formal ethical consent from the medical superintendent of Mamata General Hospitals, and the study was conducted in Mamata General Hospital in Khammam, and formal consent was obtained from the clients who underwent abdominal surgeries and confidentiality of the response was assured, and a brief introduction about the self and the study was explained, and the investigator assessed pretest knowledge and practice by interview technique, and each individual took 30 minutes to complete interview schedule, and STP was given on the same day of pretest, and post-test was done after a 1 week, which means basically we will use after 7 days by using the same tool from the same sample. So there is a schematic presentation. Schematic representations of research design is the research approach is quantitative and evaluative approach. Research design is a pre-experimental research design, and study setting is a surgical and OBG wards at Mamata General Hospital, Khammam, Telangana, and target population is between the age group of 21 to 60 years who underwent abdominal surgeries, and accessible population is who underwent selected abdominal surgeries, and sample size is the age group 21 to 60 years, and sample size is 60, and data collection instrument was taken, and data collections and analysis interpretations. And next comes to the analysis and interpretation. And analysis and interpretations I divide into the 4 sections. The first section, which I measure the frequency and percentage distribution of the clients according to their socio-demographic variables. And section 2, frequency and percentage distribution of the clients according to the knowledge and practice levels regarding incisional hernia. And section 3, association between the knowledge scores of the clients with their socio-demographic variables, and association between practice scores of the clients with their selected socio-demographic variables. So section 1, you can see here the percentage distribution of the sample according to the age. In age, the majority of the persons who are between the 51 to 60 years of age, and percentage distribution of the sample according to the gender. So gender already we seen in incidences, there are approx 25% of men who are underwent incisional hernia. So the distribution of sample according to gender also, the majority is in males only. And percentage distribution of the sample according to the religion. According to the religion, the majority we can see in the Hindu. And percentage and distribution of sample according to the educational status. That is, non-literates are having more incisional hernias rate. And percentage distribution of sample according to the occupational status. So the majority of occupational status is private employees. And percentage distribution of sample according to the family income per month. So here you can see the family income who are between the 5,000 to 7,000, they are having more rate. And percentage distribution of sample according to the previous number of abdominal surgery. So previous number of abdominal surgery who underwent already one time, so they are having more chance to get. And percentage and distribution of sample according to the source of information. So source of information, we can see that health professionals are having majority. And when comes to the section 2, percentage distribution of sample according to the pre-test and post-test knowledge levels of the client. So pre-test, there was adequate knowledge levels are very less before we given STP. And after given STP, you can see in the diagram that there is no inadequate knowledge. So only it is moderate and adequate knowledge. Then moderate knowledge also 63.33, whereas earlier it is 70 in pre-test. And in pre-test knowledge, inadequate knowledge is 23.33. When comes to the post-test knowledge, there is no inadequate knowledge. You can see only moderate and adequate knowledge levels only. Because after post-test we provided STP, so that is the reason we did not get any inadequate knowledge in the samples. And next come to the same percentage and distribution of the sample according to the pre-test and post-test practice levels of the client. So we same here also before giving practice checklist. So they're having poor practice is there in 16.7%, but after giving practice checklist and all this thing STP, so there was improved and there is no poor practice only we can see in the fair practice and good practice. That is, fair practice is 82% and good practice is 18%. And next, section 3, effectiveness of structured teaching program on knowledge levels regarding incisional hernia and its prevention. So pre-test mean was 10.65 and the standard deviation is 2.99, and post-test 15.85 and the standard deviation is 2.48 I got, and mean differentiation is 5.2. Mean differentiation, the pre-test and post-test I taken, and calculated table t-value, paid t-test value is 18.7 and it is got significant. And next come to the practice scores. So effectiveness of structured teaching program and practice scores regarding incisional hernia and its prevention. So pre-test is 7.06 and post-test is 9.16 and standard deviation is 1.67 and post-test is 1.17. The mean differentiation is 0.5 and table t-value is, paid t-test is, paid value is 25.1. It is significant. And when comes to the association between the post-test knowledge and practice scores with their selected socioeconomic variables. So here I mentioned only which I got significance. Out of 8 samples I got in knowledge, only 1 sample I got significant, that is previous number of abdominal surgeries. The chi-square value is 6.28 and previous number of abdominal surgeries. When comes to the practice score also same sample I got in significance, and source of information also I got in practice scores. And when comes to the recommendations, a similar study may be conducted in different areas with larger sample with the pre-experimental design, and a similar study can be done in descriptive approach, and educational programs must be conducted in all surgical wards about incisional hernia and its prevention. Similar study can be planned as an experimental study, and similar study can be conducted among the healthcare personnel with the help of structured teaching program. And the study concludes that the STP for who underwent abdominal surgery was very informative, which was revealed by enhancement of knowledge and practice scores, and also the statistical values revealed that there is a significant effectiveness of structured teaching program. Thank you, sir.
Any questions? Vishwas, you have the 2 variables, knowledge and practice.
Yes, sir.
You can add one more objectives, that correlation. Okay. When the knowledge increasing, what about the practice? It is increase or decrease. Okay. Like that can add, Karna. Another one is, there is one, I think, typing mistake in the technique table. Pre and post test practice. Okay. That mean difference 0.5 only. But significant coming t value 25 you mentioned. It's not possible. Please go with that slide. One more. This one, 7.06 and 9.16. It's almost 2.10.
Yes,
that is only mean difference.
Mean difference is
it's 0.5. It's maybe the standard deviation of the enhancement test.
Yes,
that's only. Otherwise, the t value is correct. What I mentioned. Good presentation as systematic steps in your study. You can see the wage difference so huge, 20 to 60.
60 years.
Maybe sample name. No?
Yes, sir. Because of sample.
That's what. Otherwise, I seen remember all the steps of research. Thank you.
Thank you, sir.
Good presentation.
One more correction is there, sir.
Yes, yes.
In your hypothesis,
yes, ma'am.
You have stated your hypothesis in a future tense.
Yes, ma'am.
It should be always in a present tense. Means आपने will be लगाया हुआ है ना, वहाँ is आएगा.
Already completed, na? Research
yes,
completed. Past tense.
I did not edit, sir. Typographical mistakes, sorry. So,
yeah.
Okay.
Thank you.
Thank you, sir. There is one announcement. We have shared our link for post test in your group, so kindly fulfill your response. Meanwhile, Now, moving towards our next paper presentation, I would like to invite Ms. Anjali Sukla, Assistant Professor, Jivandeep College of Nursing, to present her scientific paper. Ma'am, please.
Good afternoon, all. Myself, Anjali Shukla, Assistant Professor in Jivandeep Nursing College, Varanasi. Thank you, ma'am, for giving me a chance for paper presentations. Now I will start. इसमें on है? So firstly, I will deal with my problem statement. A study to assess the effect of teaching cum demonstration on knowledge regarding selected aspects of essential newborn care among postnatal mothers admitted in selected hospital, Lucknow. Introduction. In India, most of deliveries happen in homes under the watchful eyes of elders or TBA. The care of newborns received depends a lot on the knowledge of the mother. The primary gravid mothers are supposed to be lacking in knowledge, practices of newborn care. It is believed that mothers were the first nurse who take care and met the primary needs of the newborn babies during wellness and illness. Essential newborn care is a set of recommendations from designed to improve the health of the newborns through interventions, preconceptions during pregnancy, and postnatally. It includes thermoregulations, clean delivery, cot care, and initiations of breastfeeding with immunizations and eye care, recognitions of danger signs, and care of preterm or low birth weight baby. Essential newborn care is care that every newborn baby needs regardless of where it is born. ENC should be applied immediately after the baby is born and continued for at least the first 7 days after birth. Many ENC interventions are simple and can be provided by a SBA or CHW or TBA or by a family member supporting the mother in a health facilities or at home. Now research objective is, first one is assess the pre-existing knowledge regarding selected aspects of essential newborn care among postnatal mothers. Second objective was evaluate the effect of teaching cum demonstration on selected aspects of essential newborn care among postnatal mothers. And third objective was associate the knowledge with selected demographic variable among postnatal mothers. Now there is hypothesis. First hypothesis is there is a significant difference between pre-test and post-test knowledge among postnatal mothers at probability 0.05 level of significance. S2 is there is a significant association between knowledge and selected demographic variable among postnatal mothers at P levels 0.05 level of significance. Now operational definition for ENC according to researcher. Care refers to the care of baby from birth to 4 weeks of age regarding thermoregulations, hygiene, bathing, eye care, umbilical cord care, diaper care, preventions from infections, and immunizations just after birth. Variables. First one is independent variable, teaching cum demonstration. Second one is dependent variable, knowledge of selected aspects of essential newborn care. Third one is demographic variables, age, educational qualifications, family, monthly income, type of family, previous knowledge, and source of knowledge. My methodology was, first is research approach, quantitative research approach. Research design was pre-experimental. In that one group pretest post-test design. Sampling technique was convenience sampling technique. Sample size was 30 and I took pilot study sample in Era Medical College, Lucknow, and main study in Balaganj Hospital Maternity Center, Lucknow. Population, postnatal mothers, target population, postnatal mother who was present in selected hospital. Sample, postnatal mothers present in hospital and who was present during the time of data collections and fulfill the inclusion criteria. So this is a result according to demographic variables. First objective was to assess the knowledge regarding selected aspects of essential newborn care among postnatal mothers in terms of pretest. According to this, mean was 13.2. Objective second, evaluate the effect of teaching cum demonstrations on selected aspects of essential newborn care among postnatal mothers. In this, mean was 22.4. So, mean and mean percentage distribution comparison of pretest and post-test knowledge score. In pretest, mean was 13.200, mean percentage was 44%, standard deviation was 1.97222, pair t-test value is 13.052 according to pretest and post-test, and different and frequency distribution was 29. And there was enhancement of 9.233. Objective third, associate the level of knowledge with selected demographic variable among postnatal mothers. So total major findings of the study was, the study result shows that the effect of teaching cum demonstration on selected aspects of essential newborn care among postnatal mothers was done by using pair t-test. The mean score was increased from 13.2000 to 22.4333, which showed a marked difference of 9.2333 respectively, and the standard deviation was increased from 1.97222 to 3.34956 after the administration of teaching cum demonstration. The pair t-test value at 13.052 was highly significant at p level 0.05 level, so the research hypothesis H1 was accepted. Result also reveals that there was no significant association between the selected aspects of essential newborn care with the selected demographic variable. It indicates that the effectiveness of teaching cum demonstration on increasing the knowledge on selected aspects of essential newborn care among postnatal mothers. Summary. In present study, the researcher investigated the effectiveness of teaching cum demonstration on selected aspects of essential newborn care among postnatal mothers. The objective of the study was to assess the effect of teaching cum demonstration on selected aspects of essential newborn care among postnatal mothers, to compare the pretest level of knowledge with the post-test level of knowledge scores, and to find out the association between level of knowledge with selected demographic variables. The samples were selected by non-probability convenience sampling technique, and 30 postnatal mothers who got admitted to Balaganj Hospital Maternity Center, and those who fulfills the inclusion criteria was selected for the study. The data was collected by administering the tool to the samples after administration of teaching cum demonstration. The data was analyzed by using descriptive and inferential statistics. The researcher found that there was a significant improvement in post-test level of knowledge among postnatal mothers after the administration of teaching cum demonstration as compared to pre-test level of knowledge with the same group of postnatal mothers. Recommendations was, a similar study can be replicated on larger sample. An evaluative study may be conducted to investigate the effect of selected aspects of essential newborn care knowledge on well-being of the mother and her newborn baby. A study needs to be carried out in the urban and rural areas to find out the difference in knowledge, and comparative study can be carried out between primary postnatal mothers and multigravid mothers. So references was, according to WHO I took, and according to Piyush Gupta, Essential Newborn Care Pediatric book is there. So I took some references from there also. And Amolo L Knowledge Attitude Postnatal Mothers, this was a thesis. So I took some things from this also. And one is Maternal Child Survival Program. Thank you.
Any questions?
Actually, Anjali, I don't have any question, but I just want to clarify data that the most of the birth are happening in institutional. 21-22 data says 95.5% birth happens in the institution. Just want to tell you that.
Okay.
Thank you.
Any questions? I may have one. Your teaching come demonstration.
Demonstration.
But you are evaluating them only knowledge questions.
Yes, sir.
What about demonstration?
Sir, demonstration में umbilical cord care
You are teaching.
teaching with demonstration.
Okay. When you are assessing that variables, you can add one more skills also.
Okay.
Skills also or practice also. After teaching with the teaching come demonstration, teaching is give the knowledge. Demonstration provide the knowledge, practice or skills. So
Okay, sir.
they be sample how they improving the day-to-day activity or their care of the child. So like that, you can checklist you can prepare and you can add
Yes,
it.
sir.
With, you can get the additional weightage of the research.
Okay, sir.
Very good, nice study.
Thank you,
One
sir.
more.
So, in your study, when you have assessed one, the best part which is for the study is you can publish it 2 times. First, with your knowledge thing, and second, after assessing the practice, and third point which you can do is you can find the correlation between them. So, this objective you can add, and then again, it will be strengthening your study, and then you can get 2 publication out of this one study.
Okay.
Go for it.
Thank you. Thank you, all of you.
Thank you. Thank you.
Thank you, Ms. Anjali. Moving forward, now I would like to invite Ms. Rachna Sen, Assistant Professor, Jeevandeep College of Nursing, to present her scientific paper.
A very warm good evening to Director Sir, Principal Ma'am, all dignitaries, and my dear students. Myself, Rachna Sen, Assistant Professor of Jeevandeep Institute and Paramedical Science, Bhadoi, Varanasi, Department of Obstetrics and Gynecology. Today I will present my research presentation. So, title of the study, I study to assess the effectiveness of structured teaching program on knowledge regarding selected aspect of adolescent health among adolescent girls in selected school, Lucknow. Introduction of this study, there are 253 million adolescents in the age group of 10 to 19 years in India. This age group comprises of individually in a transitional phase of the life requiring nutrition, education, counseling and guidance to ensure their development into the healthy adult. They are susceptible to the several preventable and treatable health problems like early unintended pregnancy, unsafe sex leading to STI, HIV, AIDS, and nutritional disorder like malnutrition, anemia, overweight, alcohol, tobacco, and drug abuse, mental health, concern, injury, and violence. Government of India has recognized the importance of influencing health-seeking behavior of adolescents. Therefore, investment in the adolescent reproductive and sexual health will aid divided in the delaying age of marriage, reducing the incidence of the teenage pregnancy, meeting unmet contraception needs, reducing the maternal mortality, reducing the STI and incidence, and reducing the HIV prevalence. Need of the study, the researcher experienced that during her clinical posting observed that the adolescent girls were not having the sufficient knowledge regarding the adolescent health, so that why they become sick and unhealthy. Globally, 1 lakh adolescent girls dies every year before they reach the age of 20 years. Of these deaths, 30% occur due to the unhygienic menstruation, 10% death occur due to the unadopted puberty changes, 20% death occur due to the early pregnancy in the adolescent period. The aims of the study will be assess the level of practice of knowledge and associate factor of the adolescent health. Several studies too showed that every year girls do not know how to take care of herself. It will lead to the increased adolescent mortality and morbidity rate. Objective of this study assess the existing knowledge on selected aspect of adolescent health among the adolescent girls, evaluate the effectiveness of the structured teaching program on selected aspect of adolescent health among the adolescent girls, associate the level of knowledge score on adolescent health with the selected demographic variable among adolescent girls. Hypothesis of this study, H1, there is a significant difference between pre-test and post-test knowledge score among adolescent girls. H2, there is a significant association between the knowledge score with the selected demographic variable among the adolescent girls at the level of 0.05 level of significance. Variables under the study, dependent variable is structured teaching program, dependent variable is knowledge on adolescent girls, demographic variable is age, class, type of family, previous knowledge and source of information. Methodology of this study, research approach is a quantitative research approach, research design is experimental research design, one group pre-test and post-test design. Research study, girls inter-college Muktiganj. I have to done my study to pilot study and main study in this college. Population is adolescent girls of the Lucknow. Target population is adolescent girls of Thakurganj, Lucknow. Accessible population is adolescent girls nearby the Girls Inter College Muftiganj, Lucknow. Sample adolescent girls who are in the age group of 11 to 19 year of age group. Sample technique is convenience sampling technique. Sample size is 40. Objective of this study, first assess the existing knowledge on the selected aspect of adolescent health among adolescent girls, frequency, percentage and mean distribution of the level of test score. So in this, the score is mean 12. Second is frequency, percentage and mean distribution of the post level of the knowledge, that is 22. Second objective, evaluate the effectiveness of the structured teaching program on selected aspect of adolescent health among the adolescent girls, mean percentage distribution, comparison of the pre-test and post-test. In this pre-test mean is 12, post-test is 22, enhancement and pair t-test 3.638. Different frequency distribution is 3. There is a enhancement of 10. Last, objective 3, associated the level of knowledge score on the adolescent health with the selected demographic variable among adolescent girls. Here the data given below, age, class, type of family, previous knowledge. Major finding of this study, the researcher calculate the value of chi-square in order to find out the association between the level of pre-test knowledge score with the socio-demographic variables among adolescent girls, level of significance. The data present in the above table show that was significant association level between the knowledge with the class, that is 10.11, previous knowledge 23.9. There was no association between the level of knowledge 5.70, type of family 3.41, source of knowledge 4.87. Hence, it was calculated that all the value expected, source of information and less than the table value. So researcher accepted their research hypothesis. Conclusion of this study, the difference between the pre-test and post-test score revealed that the structured teaching program is very effective in the improving the knowledge of adolescent girls. They are studying in the 8th, 9th, 10th and 11th, 12th classes. The pre-test knowledge of adolescent health significantly associated with the variable like previous knowledge, class, and there is a no significance association between the pre-test knowledge and age and type of family and source of information of this group of study. Summary of this study, the present study, the researcher investigate the effectiveness of the structured teaching program on knowledge of the demographic variable. The researcher found that there was a significant improvement of the knowledge of the adolescent girls after the structured teaching program. Some of the demographic variables like source of information and previous knowledge. They are the recommendation and differences. Thank you so much. There is any doubt?
No.
Okay, thank you. Thank you all of you.
Thank you. ma'am.
Thank you.
Thank you, Ms. Rachna, for the scientific paper presentation. Thank you, our scientific research committee, for your evaluation and guidance. Thank you, sir. Thank you, ma'am. And thank you to all the presenters.
You don't, you don't, you don't have to be great to start, but you have to start to be a great. As every individual needs and of course desire appreciation to move forward. So we are moving towards our valedictory session, and I request our Director Sir, Mr. R.K. Bajpai Sir, and Principal Ma'am, Professor Dr. Archana Chauhan Ma'am, to come to the stage to present memento and certificate to our respected speakers. Sir and Ma'am, please.
Now, I request Dr. Neeta Rajesh Bhide ma'am to come on the stage and receive your memento from ma'am. Thank you, ma'am. Now, I request our director, sir, to present a memento to Miss Renuka GB, National Midwifery Educator, National Midwifery Training Institute, Meerut.
Thank you, ma'am. Now I request Mrs. Nima Bhaskar ma'am, Vice Principal, College of Nursing, Ayodhya, to come to the stage to receive memento and certificate from our Director Sir and Principal ma'am. Thank you, ma'am. Now I request Ms. Renata ma'am, International Midwifery Educator, Lithuania, UK, to receive a certificate of panelist from our Director Sir and Principal ma'am.
Now, I request Miss Ruxana Khatun ma'am to come on the stage and collect your certificate and memento from Saran ma'am.
Now I request Dr. D. Vaskaraj Sir, Principal, College of Nursing, Ambedkar Nagar, as a research paper evaluator. In spite of his busy schedule, he came from a very long distance for us. Thank you, sir.
Now, I would like to request Mr. Jaipal Singh sir from organizing committee member to come on the stage and collect memento and certificate. He given us a full support and effort in giving us lots of registration. Thank you, sir.
I would like to thank social media team of Directorate General of Medical Education and Training Uttar Pradesh. They cover us for 3 days, and we are heartily thankful to them for helping us to make this event successful one. I would like to request representative of social media team of Directorate General of Medical Education and Training Uttar Pradesh. We have Dr. Aman Chaturvedi sir here to receive a memento. Now, moving forward, we would also want to appreciate the effort of our mentee colleges for the bulk participation. So here, I request one senior faculty from Desi College, Lucknow, to collect your memento from Director Sir and Principal Ma'am. Desi College. Dr. Rachel Singh. Now, I would like to request one of the senior faculty from Indian Institute of Medical Science, Ayodhya, to come to the stage and receive the memento from Sir and Ma'am. Now, I would like to request one senior faculty from Sri Sai School of Nursing, Sultanpur, to collect memento and certificate from Director Sir and Principal Ma'am. Now, I would like to request one of the senior faculty from Jibandeep Badoi to come to the stage to receive a memento and certificate from Sir and Ma'am. Now, I request one senior faculty member from PPS Barabanki to come on the stage and collect your memento and certificate from Director Sir and Principal Ma'am. Now, I would like to request one of the senior faculty from Jyoti Hospital and Nursing College to receive a memento from Sir and Ma'am. I would also like to request our Director Sir and Principal Ma'am to present a certificate to our paper presenter. So I would like to request Anjali Sukla Ma'am to come to the stage to receive her certificate. Now, I would like to request Rachana Sen Ma'am to come to the stage to receive your certificate from Sir and Ma'am. Now, I request Ms. Sushmita Chaudhary Ma'am to come on the stage and receive certificate from Director Sir and Principal Ma'am. Now, I request Mr. Vishnu Prakash Sir, Associate Professor, TSM College of Nursing, to collect certificate from Sir and Ma'am. with this came to the end of our valedictory session. So thank you, Director Sir and Principal Ma'am. Thank you very much. All the participants are requested to collect their certificate after this session, after the vote of thanks. Continuing with our valedictory session, I would like to request our Principal Ma'am, Dr. Archana Chauhan Ma'am, to come to the stage to present a memento to our conference committee. Firstly, I would like to request Mr. Hemendra Pal Singh, Professor of Baba College of Nursing, as our organizing committee to come to the stage to receive the certificate and memento from ma'am. Now, I would like to call upon Mrs. Manila Bibin, ma'am, Assistant Professor, Baba College of Nursing, as an organizing committee member to receive a memento from ma'am.
Now, I would like to call Manita ma'am, as Professor, Baba College of Nursing. Please come.
Now, I request Mr. Abhishek Dhamania sir from registration committee to come and receive memento from our principal ma'am.
Now, I would like to call upon Ms. Ruchi Divedi ma'am to come to the stage to receive the memento from Principal ma'am. Ruchi ma'am, as a registration committee member.
Now, I request Mrs. Durba Ganguly ma'am from registration committee.
I would like to request our director, sir, to join us in valedictory session.
Now, I request Ms. Saloni Chaudhary from registration committee to come on the stage and collect memento from. Okay. Now, from scientific research committee, I request Mr. Nitin sir to come on the stage and collect your memento from director sir and ma'am.
Now I would like to call Mrs. Anjali ma'am to come to the stage to receive a memento from our director, sir, and principal ma'am as a scientific research committee.
Now, I request Mr. Gagan Verma sir from Scientific Research Committee to come on the stage and collect memento from our director sir and principal ma'am.
Now, I would like to call Mr. Ankur sir from Transport and Accommodation Committee to come to the stage to receive a memento from our director sir and principal ma'am.
Now, I request Ms. Jyoti ma'am from Transport and Accommodation Committee to come on the stage and collect memento from director sir and ma'am. Okay. Now, I request Mrs. Pooja Tiwari ma'am from Transport and Accommodation Committee to receive. Okay. Now, Mr. Ambika sir from Catering Committee to, I request him to come and collect memento from director sir and principal ma'am.
Now, I would like to call Ms. Bemita ma'am to come to the stage as a catering team committee to receive a memento from our director sir and ma'am, principal ma'am. Now, I would like to call upon Ms. Aradhana ma'am to come to the stage to receive a memento from our director sir and principal ma'am as a catering committee.
Now, I request Mrs. Anshika Nandan from Cultural Committee to come on the stage and receive memento from director sir and principal ma'am. Now, I request Mrs. Sanjana Oja ma'am from Cultural Committee to come on the stage and receive memento from director sir and principal ma'am.
Now, I would like to request Ms. Anusika ma'am to come to the stage and receive a memento from our director sir and principal ma'am as a cultural committee member. Now, I would like to request Ms. Neha ma'am to come to the stage to receive a memento from our director sir and principal ma'am as a cultural committee member. Thank you, sir and ma'am. Thank you so much. So finally, we came to the end of our program, and I would like to call Mrs. Anjali Chaturvedi ma'am for a vote of thanks. Ma'am, please.
The way to develop the best that is in a person is by appreciation and encouragement. So, with this quote, I A very warm good evening to all of you, and thank you, Baba College of Nursing, for giving this opportunity to me. And I deem it a great honor and privilege to propose the vote of thanks on this auspicious occasion. So, first of all, start by giving glory to the Almighty God for making our 3 days event as a resounding success. I stand here today as a proud and grateful faculty to express my heartfelt thanks to all those who have made this event possible. Firstly, I would like to start by thanking the patron of Baba Educational Society, our director, Mr. R.K. Bajpayee sir, who have always been supportive of our initiatives and encouraged us to strive for excellence. So, a big hand together for the our director, sir. Please. Thank you, sir. Now, I would like to express my sincere thanks to our esteemed principal, Dr. Archana Chauhan, ma'am, for expertly organizing and leading this memorable occasion with such efficiency. And we are truly grateful for your leadership and management. Thank you, ma'am. I would like to express my appreciation to our chief guest, Mr. Alok Kumar, IAS Principal Secretary, Medical Education, Uttar Pradesh. Your blessings has added an extra spark to this event and made it even more special. I would like to propose a vote of thanks to our guest of honor, Dr. Alok Kumar Sir, Secretary, Registrar, UP State Medical Faculty, for giving his valuable presence. Our deepest gratitude to our esteemed guest of honor, Ashok Kumar Visnoi Sir, Professor, Dean, Nursing Faculty, Atal Bihari Bajpayee Medical University, for gracing our event with your presence. So, thank you, sir. I would like to extend my heartfelt thanks to our guest of honor, Dr. Manju Chugani ma'am, Dean, School of Nursing Sciences and Allied Health, Jamia Hamdard, New Delhi, who was also the speaker of our international conference. So thank you so much, ma'am, for providing the priceless, valuable advice for the improvement of natural birthing process. I would like to extend my gratitude to our esteemed guest of honor, Dr. Usha Okande ma'am, Director Education, Cermex Nursing College, Indore, Madhya Pradesh, and she is also a speaker who have given their priceless time and valuable cooperation for enlighten us regarding preparation of the woman for natural birthing. So thank you, ma'am. And I would like to express my appreciation to Dr. Adela ma'am, manager and leader, Darji Fellow, for giving us their ideas and knowledge regarding hydro birthing. I owe a special gratitude to Miss Karen Breton ma'am, International Midwifery Educator, UK, and Miss Sheetal Saini ma'am, National Midwifery Educator, for spreading their expertise regarding the antenatal exercise towards normal birth. I would like to extend my gratitude to Miss Renata ma'am, International Midwifery Educator, UK, for enlightening us regarding natural childbirth. Thank you, ma'am. I owe my appreciation to Miss Renuka Jibi ma'am for providing the knowledge regarding maternity care guidelines. I express my thanks to Dr. Neeta Rajesh ma'am for making such a great awareness regarding colostrum feeding and harvesting. Thank you so much, ma'am. Then, now I would like to thank Mrs. Mary Malik ma'am, President of UP State Branch TNAI, and Mrs. Bhumika Singh ma'am, Secretary of UP State Branch TNAI, for their cooperation and support. I would like to thank to Dr. Suraj Kumar sir for your presence. Thank you, sir. Now, I would like to extend my thanks to Mrs. Neema Bhaskara ma'am for your cooperation and support. I again extend vote of thanks to Dr. D.E. Bhaskara sir for sharing your ideas, expertise, and knowledge related to scientific research. Thank you, sir. I also extend my appreciation to the Ruxana Khatun ma'am for your beautiful panel discussion. Thank you, ma'am. I also extend my thanks to Mr. Srikant sir from EBIC team as he supported us to conduct this conference. Thank you, sir. I am thankful to all the faculty members of Baba Educational Society for their dedication and support towards making this international conference successful. And I also thankful for all my students for their support and participations. Thank you, all of you. Let us give applause and heartfelt appreciation to all those who contributed to this event as a resounding success. Finally, I would like to convey my gratitude to everyone here to give your time for joining and assisting us for making this event as a huge success. So thank you so much everyone gathered here. Thank you. Please stand up, all of you, and ready for national anthem. जन गण मन अधिनायक जय हे भारत
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
भारत माता की. Thank you everyone.
So thank you each and every individual who have assembled here, and because of whose effort this event has been a grand success. And especially I would like to thank our director sir, Mr. R.K. Bajpai sir, and especially our principal ma'am, Professor Dr. Archana Chauhan ma'am, because of whose